You're on.
Morning, everybody. Welcome to our special City Council meeting, Las Cruces City Council. Today is Friday, July 24th, 2020. It's approximately 9 a.m. Before we begin, if you please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Excuse me. Okay, so now we have our conflict of interest statement. This is where I'll ask if any member of the city council, city manager, or any member of the city staff has any known conflict of interest on any item on the agenda.
None for me, Mayor.
Okay, seeing none. So we're going to go to item 2.1, resolution 21-020. Just need a motion and a second, please.
So moved, Gondara.
Second, Council Sword.
Okay, motion made by Mayor Pro Tem Gondara, second by Councilor Sorg. And I believe Dr. Griselda Martinez or Dr. Francisco Payares will be discussing.
Hello, good morning, Mr. Mayor. Hello, members of City Council. How are you? I just want to make sure this is Francisco Payares for the record. I just want to make sure that everyone can listen to me.
Yes.
Excellent. Mr. Mayor and members of the City Council, let me start sharing my screen. And if you could please confirm that you're seeing my PowerPoint presentation.
Yes.
Excellent. Excellent. Well, thank you very much, Mr. Mayor and members of City Council. Today we have a resolution to implement the Las Cruces Safe Promise. The first thing that I wanted to mention, Mr. Mayor, is that this is the initiative or one of the first action items that have been coming forward from the Las Cruces Economic Recovery Board that you created along with the members of City Council back in April, if I'm not mistaken. So the Las Cruces Safe Promise, and a little bit of background, and actually that was my first point, the City Council of Las Cruces approved Resolution 2161, creating the Las Cruces Economic Recovery Ad Hoc Board. And then on July 9th, the Las Cruces Economic Recovery Board approved the Las Cruces Safe Promise as a recommendation for the implementation from City Council. What is the Las Cruces Safe Promise? This is a campaign to encourage the residents and visitors and customers of Las Cruces to carry out COVID-safe practices. In essence, this is for individuals who want to show commitment to following COVID-19 safe practices. These are wearing a face mask, maintaining a 6 feet distancing from others, and other recommendations to prevent the spread of COVID-19. It will be complementing the New Mexico Safe Promise, which is aimed at individuals, and it's a campaign by the state, as well as the New Mexico Safe Certified Program, and also for businesses to get a certification and get training in some of the COVID safe practices. And I just wanted to point out that the state has created this certification for certain industries. Not all industries are included yet in there, but there's plenty of them. So I'll be explaining some of those. So what is the Las Cruces Safe Promise? And the logo on your left is just a placeholder. We found that this is pretty similar to one of the logos in one of the departments, and we're in the process of perhaps adjusting it. But right now we've left it as a placeholder. The Las Cruces Safe Promise is, first of all, that I promise to act as if I carried the coronavirus. I promise to maintain social distancing of at least 6 feet. I promise to wear a face mask covering, wash my hands, and use sanitizer. I promise to buy from local businesses that also make this promise. I promise to practice patience, compassion, empathy, connection, respect, and love. That is what the Las Cruces Safe Promise. And as I was mentioning to you, Mr. Mayor and members of the City Council, this is for individuals that want to show a commitment in following COVID-19 safe practices and ultimately trying to restore the consumer confidence, getting people with the ability of feeling comfortable of going to a business that knows that practices some of these that follow some of these guidelines. The New Mexico Safe Certified. So what are we going to do? We're going to be launching the Las Cruces Safe Promise, and we're going to be linking, and basically we're just going to be providing a link in the webpage to the New Mexico Safe Certified. The New Mexico Safe Certified is a program for businesses, and these are for businesses that get basically a COVID-19 practices training program. And this is going to be aimed at, so these are the businesses that are currently part of the list, but the list is potentially going to be expanding. So these basic training programs are aimed or designed for each individual industry to fit the needs of each of the individual industries. What are some of those industries that are already capable of getting the New Mexico Safe Certified? And again, this is going to be carried by the state. And the Las Cruces Safe Promise is for the individuals, and we will be connecting for the New Mexico Safe Certified program in the webpage. Restaurants are going to be part of it. Hotels are going to be part of it. Retail stores, golf courses, tours, salons and spas, offices and call centers, construction companies, field operations, manufacturing, warehousing, and food production, as well as grocery stores, farmers market, farms, ranchers, and dairy producers. All of those are the current ones that the New Mexico Department of Tourism has established for some of those trainings. There's potential for those trainings to expand, but for right now, those are the ones that are currently in there. So what are the benefits, basically, of those businesses that go through this New Mexico Safe Certified certification? First of all, they're going to have an alignment with the visible New Mexico Safe Certified brand. The usage of the New Mexico Safe Certified seal is going to be included so that they can promote their business. There's going to be presence in the New Mexico Safe Certified.org business directory. There's going to be an admission to personal protective equipment procurement collective so that they can get some of the PPE at a reduced price. The New Mexico Safe Certified Resource Toolkit. They will also receive the latest news about the revisions and updates of Altogether New Mexico, the safe practices. They will also access to a statewide peer learning groups to share best practices, troubleshoot common challenges, and access additional resources. Tourism-related businesses who have their employees go through the New Mexico Safe Certified training will receive $250 digital advertising credit per person and up to $2,000 from the New Mexico magazine. So all of these are going to be benefits for those businesses that follow the New Mexico Safe Certified. So far, what do we have? We have the Las Cruces Safe Promise, which is the promise for the individuals, and we are going to be connecting to the New Mexico Safe Certified, basically providing a link so that businesses can certify themselves into any of these industries that we were describing just in the slide previously. What is the strategy for the campaign? Well, the Economic Development Department and the Community Engagement Office will basically, after your approval on initiating this campaign, they will be initiating a 3-month timeline. And it's going to be very similar to the Go Bond, as well as some other campaigns that have been carried for quality of life, in which we will develop a brand and an implementation plan. We will launch the website and the campaign, and actually we've been working on the website. We just need the approval so we can launch and start launching it. This is a grassroots campaign targeting at residents and businesses, and the methods in which we're going to make this campaign to exist with awareness include utility bill inserts, which has a reach of about 44,000 people, repeated e-blasts to businesses. There's approximately 3,000 businesses registered, so that's about 3,000 people, as well as to the community partners, right? We're going to be sharing this to some of our community partners so that they can take the promise, social media, as well as radio presence. This is going to be an ongoing campaign evaluation after the 3 months and see where we're standing afterwards. Besides having your council options, I just wanted to let everyone know that we currently have the chair of the Las Cruces Economic Recovery Board with us, Mr. Chris Shaljo, as well as the vice chair of the Las Cruces Economic Recovery Board with us, Ms. Debbie Moore. And we also have other members of staff from Visit Las Cruces, as well as from the engagement office, in case there's any questions with regards to any of this. And with that, Mr. Mayor, we're ready for discussion and your council options.
Very good, Dr. Payades. Thank you very much for this. That was very comprehensive. I like it a lot. I have one quick question. I haven't seen any questions come up yet, but one. So they'll get the New Mexico seal, certified seal, and then is there a seal for the Las Cruces Safe Promise, or no? That's just one seal.
Not for the Las Cruces Safe Promise, Mr. Mayor. For the Las Cruces Safe Promise, basically the people take the promise, and this is again for individuals, for consumers, customers, or for customers, for residents, and for visitors, to say that they're going to be engaging in COVID-19 safe practices, and this is for those individuals to say, I have taken the promise. This is my engagement as a community member, that I will behave as if I carry the coronavirus, that I'm going to maintain face masks, that I'm going to be maintaining 6 feet distancing, and all of those.
Right. And is that seal something they can put on outside their business that kind of like sticks to the
That is correct.
window?
For the New Mexico Safe Certified,
Right.
they will receive a seal. Yes, Mr. Mayor.
Looks like Dr. Martinez has her hand up, and then I'll go to the council members. Dr. Martinez?
Yes, good morning, Mayor, City Council. That is correct. What we did not want to do is duplicate efforts, and we wanted to make sure that we were fitting the Las Cruces Safe Promise into which is an awareness campaign, into the training opportunities that are included in the New Mexico certified program. So we definitely want to keep it as a grassroots initiative, and so any branding opportunity that we have, we will take that as an opportunity for implementation.
Okay, very good. So we have Councilors Bencomo, Gondara, and Sword. So Councilor Bencomo.
Thank you, Mayor. And thank you so much, Dr. Payades. I really appreciate the presentation. Honestly, what was it, like 3 months ago? I don't even know when we first started talking about this recovery council here locally. This is exactly what I imagined this council would be doing, and it's really exciting. I think it comes at a really perfect time where there's just the narrative has just been so divisive, and I think this is something that really that's really beautiful and unifying and can really pull people together. And consumers can start feeling really safe going to some of these locations, right? And seeing that seal and saying, you know what, they're doing the best they can, and I'm going to continue to support this local business. And so this is really exciting to me. I think that logo is beautiful. I'm excited to see the rollout of this campaign. I guess I did have just one question, but mostly I just wanted to commend the entire council and the staff that's been involved in this, because I think it looks really incredible. It feels really incredible. So I just wanted to say thank you. Honestly, my only question was around, you mentioned some of the certifications, some of the trainings. Who is doing those? I missed that. Is it the state or locally here in Las Cruces?
Mr. Mayor, Councilor Bencomo, it is the state, correct? Okay. So this is a series of videos, and actually to some of the businesses that have taken some of these are very helpful, and they're trained, suited, so that there's a training for restaurants, there's a training for hotels, because there's different natures within each one of those industries. So that is the state, Councilor Bencomo.
Wonderful. And they're easily accessible. It's not like business owners are going to have to wait in line to get a training. They're very easily great.
Those are easily accessible, Councilor Bencomo. Those are online.
Wonderful. I would personally love to hear from Debbie and Chris if they have something to add. I don't really have any questions particularly for them, but I'd love to hear from them on their thoughts and reactions to this process.
Yeah, thank you, Councilor. But I'm going to go with the council members first, if that's okay, and then I'll if they have anything. Okay. So we have Mayor Pro Tem Gondara.
Thank you, Mayor. Thank you, Dr. Valladares, Debbie, Chris, and the Recovery Council. I know it's been challenging for you all. Chris and I and Debbie and I had an earlier conversation as they were initiating and getting things off the ground. So I want you to know that I very much appreciate the work and the challenges, because I think it's important to note, and I agree with Councilor Bencomo, it's been so divisive, and you have people coming together that may not have the same ideas, the same value set, and so I'm glad that we can start off with something like this. I think this is really important, but it also pushes you all to be in a room that care about Las Cruces and each of their entities, obviously, but ultimately care about Las Cruces, right? That we are gonna keep each other safe. So I very much appreciate this. My question is, Dr. Payares, will the staff or directors in the various departments within the city be able to become certified as far, because I think it's important that we lead by example, and if there are places where we can get certified to ensure that not only our staff feel confident coming back as we move into the different phases, but that our consumers, right? There, people definitely go into our buildings and those things. So I know we've put a lot of PIOs out about what our safety practices have been, but I'm really interested to see if you all find a place to be able to undergo these certifications and get certified.
Mr. Mayor and Madam Mayor Pro Tem, I just wanted to be very clear. The certification is for businesses in itself, and I don't think government entities are still yet into that. However, any person can take the promise. Anyone can take the promise, right? You and I can take the promise. Directors can take the promise. Anyone, any resident, any visitor, any customer can take the Las Cruces Safe promise. So that portion as a certification in itself for the department, for our department, from the New Mexico Safe Certified, I don't think that's possible yet, at least. The list of businesses that can get in there, it has been expanding, but government entities is not one of those industries quite yet. However, people, individuals can take the Las Cruces Safe promise, right? Not the certification per se. So it's two elements. The Las Cruces Safe promise is aimed at the individuals, and the New Mexico, which is from the state, New Mexico Safe certification, that's from the state.
Okay, I think Mr. Maestas Mayor has probably his hand up to answer some of that.
Yes, David Maestas.
Thank you, Mayor. Appreciate that. David Maestas, Interim City Manager. And yes, Mayor Pro Tem, Dr. Martinez did approach me early on when we started the discussion of this, and we do plan on rolling something out to the employees so that we, in general, have a safe practices promise and understanding for all the employees for the city of Las Cruces as well. We were obviously waiting for this review now by council and approval to move forward with the entire Las Cruces Safe Practice resolution and promise from there, and then we will work on something for the city employees as well. Thank you.
That sounds good, David. I feel we're a business, right? We provide a lot of services to folks, and customer service is of utmost importance, safety and well-being. So I would definitely challenge the state to come up with a government certification. I think that would be really important for us moving forward. But thank you from the bottom of my heart. I really appreciate the work that you all are doing. Could you just note who is currently on the board, the committee? I don't, the Recovery Council. I don't think you mentioned that, Dr. Payares, and I think it's important to recognize these folks. Thank you.
And Mr. Mayor, members of the City Council, let me just quickly pull up my list, and I can certainly answer that question. For sure, of course, as Mr. Chris Shaljo as the chairman of the board, Ms. Debbie Moore as the vice chair, Mr. Michael Harris, he's a business owner, I believe from, if I'm not mistaken, District 6, if I'm not mistaken, Mr. George Miller, a member from the employee, Ms. Sharon Thomas, Ms. Brooke Montgomery, Ms. Veronica Archuleta, Mr. Ron Fitzherbert, Mr. Doug Cowan, Ms. Susan Greenwald was just recently, she just recently joined us. Ms. Jolene Martinez and Ms. Darlene Lopez from New Mexico Workforce Connections. Those are currently the members of the Las Cruces Economic Recovery Board.
Thank you, Dr. Payares. Thank you.
I'm sorry for interrupting. I just wanted to say that Michael Harris is from District 6.
Okay.
Thank you, Dr. Payares.
Thank you.
Sorry for interrupting.
It's okay. Mayor Pro Tem, are you finished?
I am, Mayor. Thank you.
David, did you have something else? David Maestas, you have something else you wanted to add? Or you forget to put your hand down? Okay, probably forgot to put his hand down.
Yes, my sincere
Okay.
apology, Mayor. I forgot to bring my hand down.
Okay. Just don't let that happen again.
I will.
Just kidding. Councilor Sorg. Councilor Sorg?
Thank you, Mr. Mayor. I almost wasn't quite ready. Yeah, could you go back to slide 4, Dr. Payares? And by the way, what a wonderful presentation you had. I very easily understand and very thorough, all the good things. There's this seal here. Could you explain again how that seal could be used or would be used or is going to be used?
Mr. Mayor, members of the City Council, Councilor Sorg, the seal right now is a placeholder. As I mentioned during the presentation, we were just becoming aware that this is actually pretty similar to one of the departmental seals. So there may be potential for being some changes with regards to it. As to the design in itself, actually, we had a lot of very useful help from the Economic Development Department folks and Visit Las Cruces. And actually, Mr. Paul Dahlgren is in the phone call, who was the designer of the seal. As for the use of the seal, the use of the seal, if it comes that we need to adjust it, it will be for the campaign in itself. This is just for the promise and for carrying out the campaign. But the only seal that will go into businesses is the New Mexico certified one, which I think is on slide number 6,
Yeah.
which that is the one. That one would go in businesses, whereas this one will go as part of the campaign. Do you need me to bring Mr. Dahlgren so that he can explain the features of the seal, Councilor?
Oh, no, not necessary. He can, but it's not necessary just now. I like it. I think having that seal in a business will tell people that it's safe to use this business. And I, for one, would like to see it in businesses to display, along with the state seal, both of them, and gives people double assurance that their business is safe for consumers. And you mentioned that as part of the campaign here, and oh boy, is that ever so important in this time we have here.
Sorry, go ahead.
Yeah, if you want to add something to that, okay.
Mr. Mayor, Councilor Sorg, there was a discussion during the Las Cruces Economic Recovery Board in which the discussion was, let's try not to duplicate some of the efforts that the state is already carrying, because the state has already put so much effort into this. And that's when we said, well, not me, I apologize, the Las Cruces Economic Recovery Board said, let's use our own portion of the Las Cruces Safe Promise for the individuals and have the New Mexico Safe Certified link to that, because they have all the design of the trainings.
Okay, that's a pretty good reason. I'm okay with that. But I also wanted to comment on how important it is for the city council to approve this as a policy in the city here, and that it shouldn't be just an administrative effort here, because it would carry a lot more weight when the city council approves it. So it's important that we're doing this today. I approve it. And then we had some video clips that we recorded here in the last couple of weeks concerning using masks. Will that be part of this campaign, the Promise campaign, do you know? Or if not, can we do some more? I don't know who can answer that. Dr. Payares?
And then, Mr. Mayor, Councilor Sorg, actually, I can defer that question to Jamie Rickman, who she's going to be assisting us substantially. She's an expert on campaign deliveries.
Awesome. Yes.
Go ahead, Jamie.
Yes, sir. Thank you very much. Good morning, everyone. It's a pleasure to be here with you this morning. Thank you for this opportunity. Just want to let you know that we have a lot of programs going on with the city currently regarding mask up and just building awareness for the protocols regarding COVID. So this is one aspect of it. And so those videos that you were doing were through the communications office and possibly also through quality of life too. But those are unrelated, but even though they deal with the same issue, but we can certainly definitely look into making video clips or connecting all of that so it's not so fragmented and make it a more unified effort. But we need to brand the Las Cruces Promise or Safe Promise campaign with that material with those video clips. So absolutely, we can work on that. We've got a preliminary engagement plan that is moving forward really well, and that'll be something. We appreciate your input on that because that's important to get everybody thinking about this along the same lines. So I appreciate the discussion, and we will definitely incorporate that.
Oh, thank you, Ms. Rickman. That's awesome. You read my mind. This is exactly what I was thinking. So, okay, I'm good, Mr. Mayor, and thank you everybody who worked on this, by the way, all the board and staff and everyone that were working on it. Then it's a good job, Mr. Mayor. Thank you.
Okay, well, sure. Thank you. Councilor Flores.
Thank you, Mr. Mayor, and thank you so very much for your presentation. Dr. Payares, as always, it's top-notch and always very easy to follow. So I personally took the promise. It came to me in my personal email, and the information I provided, however, was my address here at City Hall. I took that a day or two ago. These days are just sort of one is just running into the other. But it did come to me. I don't know if I'm on a special list for the governor. I don't know. But I did take it. And so I'm very happy to see this. And thank you, Chris, Debbie, dear friends, and Sherry and Michael, Jolene, and everybody else who met to do this. Oh, no, excuse me. It was Debbie and Chris, and the others are, well, at any rate, thank you very much. It's top notch. And I think that I agree with my colleagues, Councilor Bencomo, who really propelled this at one of our special meetings. So I want to recognize her for bringing up the concept of an economic recovery board, which we all, of course, jumped on and agreed with. And thank you very much, economic recovery board members, for all your work on this. I think that we're going to be, I think we are in the vanguard of working on resolving the COVID pandemic. And thank you, Mr. Mayor.
Thank you. Just out of curiosity, how many days do you think you can keep that promise?
Which promise are you talking about?
Yeah, exactly.
Oh, that one. Oh, yeah. Yeah, I promised to, yeah. Oh, that one. Oh, yes, I'll keep that promise. Seriously, forever, as long as I need to.
Okay, good. All right. Just want to put you on the record. Councilor Abeyta-Stube.
Thank you, Mayor. Thank you, Dr. Payares, and thank you, Chris and Debbie, and all the members of the Economic Recovery Council for working on this. I really do appreciate it, and I'm excited to see the next pieces. I do have one question, Dr. Just to make sure and to let the businesses know, is there any cost related to taking this promise, taking the training?
Mr. Mayor, Councilor Abeyta-Stube, not to my knowledge. I think this is cost-free. Any business can go in and do the promise and take the trainings. The cost is just the time that you dedicate to it.
Fantastic, thank you. And I'm hopeful that as we see more of these local businesses take these promises, that we're able to showcase them in some way and build up that community as we go further. So what that might look like, I'm not sure, but I am hopeful that we can really recognize those businesses that are really committed to that care, compassion, and safety for our community. And thank you, Mayor.
Thank you. Councilor Vasquez.
Thank you, Mayor. I am in concurrence with my colleagues on the council that this is a terrific campaign. Just want to thank everybody in our community who volunteered to be a part of this. And just want to also just reiterate that along with this amazing campaign, which actually I think builds goodwill and trust between customers and businesses, that we should find other ways to support our local economy and to support folks in addition to this great campaign, just being able to also find creative ways to support businesses and workers during this time should definitely be a component of this campaign. But overall, I'm just highly impressed and very pleased with everything that has been presented here. Staff, volunteers, Debbie, Chris, everybody who contributed to this campaign. Thank you so much for your thoughtfulness and your hard work on this. I know that personally, I would definitely patronize a business, and more likely to patronize a business with this sticker on it. And I'm sure others in the city feel the same way. So thank you so much. This is a terrific initiative, and I absolutely support it.
Great. Thank you, Councilor. Councilor Flores, did you have another comment, or did you forget to put your hand down? You're muted. You forgot to put your hand down. Okay, Councilor
I forgot
Sword.
to put my hand down, I'm sorry.
No problem.
Mr. Mayor, thank you. I just wanted to add one more thing. I truly believe that this is the kind of thing that is going to really help us keep this COVID-19 under control until we get a vaccine or some other kind of control of the disease itself. This is what we really need to do. And I just hope we can encourage the total population to follow these promises here. And I think we're going to be okay if we do that. That's all, Mr. Mayor. Thank you.
Very good. Okay, so in closing, I just want to thank the members of the committee for their thoughtfulness and being able to come up with such great ideas. Thanks for doing all this. And you know what? Did Chair Slago or Vice Chair Moore have anything they'd like to add?
No, Mr. Mayor, I think we're good as far as the committee goes. Thank you for having us on today.
Okay, and that was Chris Schlago who was just talking. Vice Chair Moore, anything?
Yes, Mr. Mayor, thank you. Thank you to you and the counselors for the support of this program. I will tell you, I think this is going to be beneficial because it's a grassroots effort.
Excuse me for interrupting. Can you just state your name, please?
Oh, Debbie Moore, Greater Las Cruces Chamber and the Las Cruces Economic Recovery Board. Sorry, Mr. Mayor. I'm so excited. A great opportunity for us to work within the community for the safe promise that goes not only through the business community, but also so the businesses know that the customers coming in are safe. And I think we can work with staff and the committee to see how we can get that logo printable, where we can cross that and make it really a good across the board marketing idea. From the chamber, I will commit that we're getting ready to push. I was waiting for today to push out that New Mexico Safe Certified. The chamber is certified. I've gone through it. And so there is a certificate that's on our window, that will be on our window. I was again waiting for that, but it is a powerful tool. And thank you again to Mr. Mayor, to you and the counselor and to staff for all their support to the board.
Absolutely. Well, thank you again for all your hard work as well. Okay, if there's nothing further, Christine, you want to call for the question, please?
This is on the motion to approve Resolution 21-020. Councilor Beta-Stuvey?
Yes.
Councilor Vasquez?
Yes.
Councilor Bencomo?
Yes.
Councilor Sorg?
Yes.
Councilor Flores?
Yes.
Councilor Gandara?
Yes.
Mayor?
Yes. Okay, so next we're going to go to item 3.1, which is basically the Department of Health question and answer. We have with us today Don Sanchez, David Morgan, and Selena Torres. So I don't know who's going to start off first.
Good morning, everyone. So, David Morgan here from the New Mexico Department of Health. Just wanted to provide, introduction, and really we are here for all of you. Any questions that you have, we're here for them.
Okay. Don, did you have anything you wanted to say?
Oops. Goodness. Yes. Good morning, City Council and Mayor. Mr. Mayor, this is Don Sanchez. Same thing. We do have some questions that were sent to us by David. So thank you for giving us some questions ahead of time to allow us to be prepared. We have Dr. Selena Torres with us now from Epi and Response Division. She's replacing Dr. Landon, who typically was with us, but he's retired. So we're happy to have her on the call with us, and I think we could probably start with answering some of those questions that were sent to us the other day, and then we had some more this morning. So I'll probably turn over to Dr. Torres if she wants to start with answers to some of those questions.
Okay, sounds good. Dr. Torres?
Can you hear me?
Yes, ma'am, we can hear you.
Okay, great. I apologize. I'm just seeing the new questions, but I'd like to pull up the older questions. And David, I know you had some responses to some of those. Do you want to start off with your responses, or do you want me to?
I would be happy to. Or
okay, great.
If it pleases the mayor and council, if you folks just want to ask your questions as well, as we've done in the past, we are happy to do it either way.
Okay, and if you wouldn't mind, because the ones who transcribes the minutes doesn't get to really watch the video. So if you can remember, and I'll try to also remember, if you wouldn't mind just stating your name every time you speak, please. So
yes,
with
sir.
that,
David Morgan, PIO, Department of Health.
No problem. So looks like the first question is going to come from Councilor Gabe Vasquez.
Thank you, Mayor. Thank you, Mr. Morgan, and for your staff for always being available to us, as well as Ms. Sanchez. I guess the role that the Department of Health has had in the conversations or the plan around the reopening of schools, wondering if you could provide just some insight as to the role of DOH and the decisions being made by the state to essentially give parents an option for in-school learning, and how that also has, and the federal conversation also around reopening of schools, and how that is currently impacting your work and the strategy for school reopening in the state.
Councilor Vasquez, Council, Mayor, David Morgan, Public Information Officer, Department of Health. There are a lot of moving pieces that went into that back to school plan. There are a lot of moving pieces that are going to continue moving forward. There was an initial plan in place, and then our case numbers started rising statewide as they were really starting to spike in states around the country. So that plan did indeed have to be revised, and we are taking this, in 2-week bites, if you will, because forecasting COVID-19 cases is not necessarily as easy as it is to forecast the weather, for example. So the Department of Health has been in contact with PED on a daily basis. Senior leadership from both departments have worked together to be able to formulate the best plan possible under the circumstances of how to be able to proceed. However, at the end of the day, it's our case numbers, it's our viral spread that is going to continue to drive those case numbers, that's going to drive our ability to be able to get back into classrooms face to face, whether you are in elementary or you're in graduate school right now.
Thank you, Mr. Morgan. I appreciate that. I will speak for myself, not for the rest of the council, but absolutely support data-driven decisions for our schools that you know, hopefully you didn't touch on this, but with the federal or the conversation happening at the federal level with this administration, want to make sure that we as New Mexicans are making the best decisions for our state and locally for our communities to keep our children safe, to keep teachers safe, to keep families safe. As you know, Mr. Morgan, many of our young students here are in mixed households, mixed generational households, and so there's a lot of children being raised by grandparents, by aunts, by other family members, not so much maybe like other parts of the country, and so the danger of young people being in contact with the vulnerable is really something that is a reality for us in Las Cruces, and I'm sure a lot of other parts of New Mexico. And so I just want to make sure that we have the best science and the best data available, because there is some mixed conversations about whether, you know, children from certain age groups are carriers, whether they can transmit the disease, whether, you know, it doesn't seem to me logical that a young person couldn't transmit the disease easier or harder than anybody else. So I just want to make sure that we are acting in the best interest of our state and our communities, especially, like I said, locally for those families that are intergenerational in their households, because it presents a huge danger to our population here. So thank you. I appreciate hearing that you're working with PED. I do just want to go back to that question, however, around the federal involvement. What is the role of the federal government at this point in the decisions that we are making to reopen our schools? What type of influence? I know we've heard rhetoric about defunding, the schools and different states who choose.
Yes. Yeah, Mr. Mayor, members of council, Councilor Vasquez, the federal issue will be something that will, always be something that we will be keeping an eye out for. Certainly, I can't speak for the governor's office. I can speak only for the Department of Health, but also I do think I can go out on the proverbial limb to be able to say that, from the top down, from the administration to our state agencies, we very much have the back of New Mexico residents. We will, continue to fight or resist any attempt on a federal level to defund. Truly, to my knowledge, at least, there has not been much movement on that, short of the bluster that we have heard on the media. That said, though, if anything has taught me, if the COVID-19 pandemic has taught me anything, it's literally how anything can happen unexpectedly.
Thank you. Thank you, Mr. Morgan. I appreciate hearing that very much. So I appreciate the reassurance on that. The other question I have is around some of our correctional facilities and also some of our industrial facilities that have industrial private corporations that have, in recent months contributed to a giant spike in COVID cases. How are we doing with Otero? What have been the mitigation, I guess, measures that the state or the Department of Health has put in place, working with our corrections department since that giant outbreak at Otero, and similarly with the meatpacking plant in Sunland Park? Since the last time that we spoke, I know several of the council members, including myself, raised some great concerns about the lack of perhaps mitigation efforts being taken to get those numbers lower. But what has been done on the state side, or the Department of Health side, to mitigate those outbreaks in those facilities since the last time we spoke?
Mr. Mayor, Council, Councilor Vasquez, our epidemiologists might be able to speak more to what has been, the level of communication between our department and the feds on this subject most recently. What I can tell you, though, is that that we are in contact with the federal government and their contractors regarding the Otero facility. There was at least at one point ongoing issues about patient transfers where that actually led to further spread of the virus across the state. But specifically to the Otero situation, one thing that I can say, because I ended up hosting here through a Zoom a press conference held jointly by the Department of Health and the Department of Corrections, is one thing that I learned along with the media is that one of the most challenging things to be able to try to control spread of the virus at the Otero facility is literally just the construction of the facility itself. It is built to maximize communal interaction, and that has its positives, but in the COVID era, it couldn't be more negative by sheer luck. So that has been really one of the greatest challenges, to be able to try to isolate a potentially contagious population in a building that is literally just built for communal living.
Thank you, Mr. Morgan. I appreciate the honesty in your answer, and I personally will advocate the state
Melinda, can you hear me?
who needs rethinking.
I'm sorry, who's trying to speak?
Hi, this is Selena Torres from the Department of Health. I'm sorry. I just wanted to add to David's comment about the detention facilities. And, we have a dedicated team that actually communicates with the facilities on a daily basis regarding, the new number of positive cases, and also assisting. And as David said, it's a challenge to try to mitigate the spread within this population. So we work with them to try to be creative and get the best level of isolation we can given their constraints. It is difficult because there is movement of, detainees or inmates between facilities, and we've tried to, we continue to try to advocate for as little movement as possible, but that will continue to be a challenge as far as the spread of the virus to other facilities. So we do work closely with them on a daily basis, and it is a considerable amount of work, but it's important to us to continue to try to mitigate that spread and protect, the community as much as possible.
Okay, thank you, Dr. Torres.
Thank you, Dr. Torres.
Mr. Mayor.
Go ahead,
Yes, Mr. Mayor, Councilor Vasquez, City Council members, I just wanted to respond to your question about Stampede to the meatpacking plant.
Yeah,
and just let you
Sanchez
know.
Speaking.
Sorry, Don Sanchez with the Department of Health, Southwest Region, Public Health. We, from the get-go, they were very cooperative in making sure that they established the COVID-safe practices at their facility. And so since then, we have gone back and done repeated testing every 2 weeks or so. And really the positives have been really possibly one from the beginning when there was several. So they've been very cooperative in putting those safe practices into place. And it's shown by the decrease in numbers of positives there at the facility. We continue to, whenever they have new employees, they send them to our health offices in Sunland Park or Anthony to get tested. So we're continually in communication with them, supporting them, and they have, like I said, they've put practices into place to keep their employees safe, and it's really shown because of the huge decrease in the number of positives. So we do continue to work with them, and if they have needs, then we're there to support them with obviously whatever they might need to as far as mitigating any other situation. But it's been successful so far, so we feel that they're putting the appropriate safe practices into place for their employees. So just wanted to give you a quick update on that one.
Okay, thank you.
Thank you so much, Ms. Sanchez. I appreciate answer to that question. I have one more question. Before that, I just want to say that I think, yes, we definitely want to protect our community and those correctional facility workers who do work in our communities and who interact with folks that are detained at the correctional facilities. But I also just want to reiterate that that the folks that are, to me, matter just as much. We don't sentence them to death by COVID, right? We sentence them to for whatever crime they committed, and you know, accordingly are there for a reason. But it's also, we also should be, I think, invested in protecting the lives of folks who are there, because it's our job, I think, as a local government, as a state government, as a federal government, to protect the safety and well-being of all of our residents, including those who are detained. And so just want to make sure that we also are mindful that these are not expendable lives, whether they're serving time for any number. We all are to find their health and their safety. As I mentioned before, we're not sentencing them to death by COVID. So let's make sure that we don't do that as much as we can with the control that we have at the state level. The other question I have before passing it on to my colleagues, who I know have probably a lot of other great questions, is just around contact tracing. I know there's been kind of an evolution of that nationally, of what that means and how we can continue to best control this outbreak and figure out who is possibly infected, who is asymptomatic, who is not. And I admittedly maybe have not heard much. I have not maybe done my own research, but trying to figure out just what the status is on contact tracing, if the state has ramped up its efforts, if there's anything that the city could do locally to increase that. But it certainly seems that in a day, I think yesterday, where we had our largest number of cases statewide, that's still a very important part of this solution. So an update on contact tracing would be great.
Councilor Vasquez, just want to let you know, sometimes you kind of fade out, in and out. So I don't know what's.
Oh, sorry.
He freezes.
Yeah, he freezes.
My internet is, for whatever reason, very unstable. I apologize for that. My question was around just a general update on contact tracing, the state's efforts on contact tracing.
Okay.
Yes, Mr. Mayor, Council, Councilor Vasquez, Dave Morgan, spokesperson for the New Mexico Department of Health. Right now, contact tracing remains a priority for the department. Rising case levels have made contact tracing increasingly a challenge. We currently have about 250 people that are trained and are being dispatched regularly, daily, for contact tracing. We need about 600 total. And we are in the process of being able to hire all of those temporary employees. There is a lot that goes into the contact tracing process, more than even I personally knew until recently, because there is a lot of training involved. There's a lot of specific questions. There is there's some kind of a call flow to this. But then also there's just the sheer number of cases. So, what we have been doing in the last week is starting to call for volunteers within our public health division, for those that have been teleworking, to be able to, if they have the ability to add to their duties, to please do so for additional contact tracing, because it's that contact tracing that in many cases leads to being able to find more cases and allows us the potential to be able to isolate those and to be able to help slow the spread of this virus. But with case numbers rising, it is going to be a very difficult balance for everyone across the board, from hospitals, to the Department of Health, to testing, but specifically, talking about contact tracing. Our ability to be able to trace contacts is right now something that we are working very hard on, to be able to get to as many as we can, as fast as we can.
Very good.
This is Selena Sotis. I would just like to add to what David said to Mr. Mayor, Council, and Councilor Vasquez. You know, one of the challenges that we have at the Department of Health, even in contacting cases to do our investigation and identify the contacts, is people not answering our phone calls. You know, we don't have a standardized message when we call that says Department of Health. And even if we did, I don't know that people would answer. So we have it's difficult to get people to answer our calls. You know, we try multiple times. We were trying to estimate yesterday how many calls we've made in this past week to cases, to contacts. And it's, you know, almost 10,000 calls within a week. It's a lot of legwork to just get people on the phone. You know, for the most part, once people are on the phone, they're very willing to provide information and are grateful to get our guidance. But that initial step, so I think as a community within your county, within your city, you know, promoting or advocating for people to, you know, if you have been tested, if you think you may have been exposed, please answer the phone. If you see a number that you don't recognize, you know, we have different strategies. We try to leave messages saying, this is the Department of Health. I'll call you back in 10 minutes. Please answer. We also use text messaging, but sometimes we just can't get a hold of people. So I think that message goes a long way in helping us get in contact with people sooner. As David mentioned, it's a huge, you know, undertaking. If you imagine just yesterday, we had 343 cases, new cases. If each of those persons just had one contact, that's an additional 343 people that we need to contact, give them instructions, have them in quarantine, and check in on them for 14 days. So it exponentially grows every single day. And so it's huge, but we're pulling every resource we have to try to get this, you know, managed as best as we can.
And David Morgan, New Mexico Department of Health spokesperson. I would also add to that some statistics that I have in front of me with regarding being able to reach folks. Our success rate on the first try is 55%. I imagine there are a lot of people like me. If I don't recognize the phone number, I'm going to let it go to voicemail initially. 55% success rate on the first call. Second call, we you know, are at about 65%. By the third call, we do get 80% of the people that we are seeking out for contact tracing. So I can't reiterate enough what Dr. Torres said. You know, the need to answer the phone or to follow up with a phone call from us is very important.
Dave, can I ask you a quick question? Do you all have capability of text messaging, or are you allowed to do that as a means of follow-up?
Yes, David Morgan, spokesperson, New Mexico Department of Health. So we have, in the last month, implemented a pre-test registration site that allows you to be able to pre-register for testing at the Department of Health locations online. And it's there that you get to be able to choose where, what medium, how you get your message back about your test results. Are you wanting a text message? Is leaving a voicemail all right? Do you want an email instead? We offer the full spectrum of where you are most comfortable and it's most convenient for you to be able to receive those test results.
All right, thank you. Sorry.
Dr. Torres, if there's anything we can do from the city's perspective in terms of getting that information out to the public about answering those phone calls or about being communicative with the Department of Health, I did not think about that. I hadn't thought about, you know, the difficulties in the contact tracing process, and I'm sure folks that don't recognize a number are apt to, you know, they're apt to not answer, especially those millennials who never answer their phones, myself included, by one year. But regardless, if there's anything our public information office can do to get the information out, that if they get a call from the Department of Health, that they should answer it, we are happy to do that. I mean, we got to be all hands on deck in terms of getting this virus under control. And so that might be, Mayor, a suggestion I might make to our public information office with guidance from the Department of Health to perhaps put out a message to our community that says that the Department of Health is actively contacting people as part of the calls from Mexico numbers, and to answer and respond, so that we can all do our part. That might be part of the equation in this whole process. So with that, I know my colleagues have some other questions. I have some additional questions, but I will pass it on to them for now. Thank you, Mayor.
Okay, well, thank you, Councilor. Councilor Beta-Stubbe.
Thank you, Mayor. And thank you, David, Don, and Dr. Torres for joining us today. I have a number of questions, but I think I'd like to start with a follow-up with that, the tracing. Are we seeing any specific patterns of where cases are occurring here in our community? And what does that look like? What type of data are we able to collect from that tracing that we're getting here in Doña Ana?
This is Selena Torres, Department of Health. Counselor, that's a good question. And so, during the case investigation process, that's when we identify areas where the person that has tested positive may have exposed other individuals during their infectious period. And, there are multiple commonalities that we're seeing show up. Workplace clusters are, as you guys know, are pretty common, and they continue to be common. Given the holiday weekend that we had, July 4th, after that, we had a significant amount of individuals reporting that they had attended parties with large groups of people. And, those are a little bit more difficult to trace because they didn't necessarily know where the party was or who the host was or the host contact information. So it becomes difficult to do contact tracing with very little to no information. So the areas for contact tracing where we have good response and are able to mitigate as much as possible are workplace employers. There's a lot of, I think it was mentioned yesterday in the press conference that there has been a lot of effort into food establishments. There have been a significant number of cluster outbreaks in those areas. And then, of course, within your region of the state, we have a pretty large a correctional facility cluster, and then also some long-term care facilities that have multiple individuals. So those are the trends that we continue to see. I mean, the cases do tend to be in the younger age groups. That's what is trending currently. But, that could change as the weeks go by.
Thank you for that. And following up with I guess the restaurant and food industries, are we seeing those cases mostly with employees, or are we seeing transfer between employees and customers having those types of transmissions?
This is Selena Torres again. So yeah, it's really difficult to identify customers that may have been exposed. Some restaurants have, when the dining rooms were open, we're asking customers to provide their contact information should they become exposed. But the majority of what we're seeing in the food establishments is with the employees.
Thank you for that. And then could we just get an update, if we have it, on what our active case numbers look like for this region right now, and our transmission rate? Just to update the public and to give us a baseline of where we're at right now.
Absolutely. So for the southwest region, which is your region of the state, we transmission, we refer to it as the R effective, which is basically for one case, how many other cases has that person transmitted the virus? It's an estimate, obviously. And we would love to have anything below 1 or even 0, right? Because that means that case did not transmit to any other people. And the good news for the southwest region of the state is that the R effective for this week was less than when it was 0.9. So it's gone down. Of course, there's a lag, right, in the estimate and the modeling because this took into account cases from last week. So then we had this bump this week. So we anticipate that probably it will go up. But the R effective for the Southwest region is 0.9, and for the entire state is 1. So it's a little bit lower than what it is for the state. The percent positivity for for Doña Ana County is 5.3%. So that means that of all the testing done in Doña Ana County, 5% of those tests are coming back positive. If you compare that to the state, so the state right now we're at 4.7%. So Doña Ana County is a little bit higher than the rest of the state. Again, this is a weekly estimate and can change. It's for the last 7 days, the measure of the last 7 days. But it gives you a little bit of perspective of, how the percent positivity. I know there were a lot of questions about how we count cases and whether people that are tested multiple times are counted multiple times in our case counts. And so we currently, the guidance that we have based on what we know about the virus and the infection is that regardless of how many times a person tests positive, we are counting them once as their single, as a single case. People are tested multiple times for different reasons. Sometimes if they're hospitalized, they're tested multiple times to determine when they may be able to be removed out of the COVID unit. There's also people that are screened, every 2 weeks if they work in long-term care facilities or are residents. So the way we take our case counts and do our estimates and our modeling is based on a person level, not a positive test number level.
Okay, thank you. And then, I'm sure many people have seen on the news that testing criteria is changing at some hospitals that are doing testing. Do you think that we will see those types of changes here in our community? And how are we doing on our testing and capacity for testing?
So the Department of Health, this is Minnesota's Department of Health, sorry. So the Department of Health has, we are still aiming to do 2,000 to 2,500 tests per day statewide. The area where the testing happens, it depends on many factors. For example, rapid response to an employer setting, a hotspot that we identify looking at our data. If we know that there's a high prevalence or a known cluster of positive cases, we direct some of that testing in that area. That being said, we have a lot of other partners within the state that are also doing testing. The governor did touch on this at the press conference yesterday, but so the larger facilities that use reference labs are no longer going, and David, please correct me if I'm not right on this, are no longer going to be testing asymptomatic individuals. However, the Department of Health will still test those individuals at the public health offices or testing events that we set up. And so, the expectation is for now that we will continue at the same pace and test as much as we have been until, if we have to reevaluate and strategize how we're going to direct testing, we will. But for now, it's going to remain the way it has been.
Thank you. And for Doña Ana, what is the testing capacity that the Department of Health has per day?
That's a good question. And this is Minnesota's Department of Health, and I don't know the answer to that question. David, do you have a sense? I mean, I know for Department of Health what our capacity is on a daily basis, but I'm not sure that we can speak to what the reference labs can do, on a daily basis, because it's not just collecting the specimens, but then it's within the lab getting the testing, the specimens processed and the results out. So there are multiple facets of that. David, do you have anything to add to that?
Yes, definitely. Testing capacity by county is kind of hard to figure out because there are multiple agencies or private practices involved in testing. So, for example, Memorial Medical Center has been testing all this time. Their samples go to a different lab than the Department of Health's lab. We also have a private service that is also doing testing, and they do their testing in-house, and it really varies based upon the test supplies that they have on a given day as to how many tests that they do. Don Sanchez can probably speak to how many samples that we collect per day, and also, those results from the Department of Health go straight to our scientific laboratory as well for testing. And then just while I'm talking here, yes, Dr. Torres is right. The Department of Health is still testing asymptomatic individuals, but within that, while our criteria hasn't changed, we still want to make sure that certain people are prioritized, including those who are actually having active symptoms of COVID-19, those who are asymptomatic but are close contacts or household members of known COVID cases, asymptomatic people who work in congregate settings like nursing homes, long-term care facilities, and then also patients who are scheduled for surgery. They need to get tested. So when we're talking about the challenge of testing, and you ask what the priority is, in a perfect world, the answer is everyone. But with rising interest in testing and the disproportional growth of caseload, that just is going to put a challenge and a strain on every aspect of the healthcare system.
Thank you. And Don, I'm not sure, do you all have the numbers of how many cases or how many tests you guys can acquire in a day through your drive-through by appointment?
Yes. Councilor Abetis Duve, Mr. Mayor, City Council members, this is Don Sanchez, Southwest Region Director for Public Health Division. So here in Las Cruces, we average about 200 a day, and it obviously it varies. One thing that has changed, that's kind of shifted over the past 2 weeks, is we used to have by appointments. You'd call, you make an appointment. Well, we've changed that to just being drive-through every morning because the demand just really started to kick up about 2 weeks ago. So we at the Las Cruces office see anywhere from almost 200 to 250 a day in the morning when we do testing there. Our public health offices out in the county, Sunland Park, Anthony Chaparral, it varies. It averages from 30 to 90 sometimes. It just depends on the day and I think what's going on. And of course, I think as mentioned before from my colleagues, when we have rapid responses too, a lot of what we're doing is we're directing those employers to come to our offices. So we're having to just kind of maintain staffing at the offices to do the community testing versus going out to some of the rapid responses. So that has something that has changed. We're needing to get more people through the drive-throughs that we have at our office. MMC averages around 400 a day. They had a high of 600 on the 13th, last Monday. So that was the high that they've seen. They have gone to testing just Monday, Wednesday, Friday. So we are really ramping up our ability to test additional folks on Tuesdays and Thursdays. We haven't seen a huge increase this week. They started this week going Monday, Wednesday, Friday. So we're just making sure that we are ramping up our staff and our supplies to be able to support whatever the testing needs are in the community. And then as David mentioned, we have a private lab as well that does testing, and they average, I think, about 400 a day. So we do have, I think, a large testing capacity within the city. And then also within the county, we also have La Clinica, obviously, that's also providing testing, not only in Las Cruces, but in 3 other communities in the southern part of the county.
Thank you. And since there has been an increase in that testing, are we seeing any changes on when people can expect the results, whether they're positive or negative?
And This is Dawn Sanchez, Councilor Stuve, Mayor, City Council, and I'll also defer to my my colleagues, Dr. Torres, as well. Now that we have, like David mentioned, the online registration application, if folks go ahead and register, they, again, like David mentioned, they can, if they have a negative result, they can go ahead and determine how they want to get the information. Again, texting, email, or phone call, or all of the above. So the turnaround time for the negative results, in my understanding, is fairly quick, 24, 48 hours, maybe 72. The positive calls, I know that all goes through our case investigators, and I might just give that, have Dr. Torres answer that question.
Yes, this is Selena Torres, Department of Health. The normal route is for the case investigators to, let the individual know that they've tested positive. However, we also have staff that are calling individuals to make sure that they get their results sooner than later. So they may be called before they even start their case investigation process. The reference labs also send the results to providers, and providers are reaching out to people to let them know. So Dawn is correct in that it is about a 24 to 48 hour turnaround to get the results. Sometimes it could be a little bit, 72 hours. That being said, most of the time when we call a case to let them know that they have tested positive, they already know about their results. So the turnaround is pretty quick to let people know that they're positive. The case investigation may lag a little bit, but once they're given the result, they are given the initial instructions on you should isolate, you need to stay home. Department of Health will be calling you with some more information.
Thank you. And if an individual has gotten a test by one of the other partner agencies, will they expect similar results, or will it vary through the different site that you go to, whether it's through Department of Health or a different agency?
David Morgan, Public Information Officer for New Mexico Department of Health, Councilor Abeta Stuve, Mr. Mayor, members of the council. Your experience may vary from location to location. So, if you're depending on the facility, they may ask different criteria. They may require different information than the Department of Health. And also they may not. And then when it comes to test results, it also has a lot of things come into play there as well, to include testing capacity. Where is their sample sent? For example, there are still locations that will send their labs out of state. For example, CVS Pharmacy. And so that extends the turnaround time as well. But for the Department of Health, as everyone has said, our turnaround time for being able to report results to you, especially if it's a positive test, is within 24 to 48 hours. And then for a negative test, there may be a little bit of a lag on that, because we're prioritizing speaking to the positive patients first.
Thank you. Do you have an indication on what that lag might be?
So the lag can vary. I would put it in the area of 4 to 5 days at tops. But what is at issue there is when there is a negative, for all the negative test results, they have to be entered into a database. So the more we test, the more people we need to conduct the testing, but we also need more people for the data entry portion of this. So my understanding is we have had days in a week where we do get backed up, but we also get caught up as well. So I don't have an exact accurate number to give you. I have what amounts honestly to a guesstimation.
Okay, thank you. And my last question before I turn it over to my colleagues, I know I've asked quite a few, so thank you for bearing with me. You know, back on our last meeting, we talked about testing capacity here in Las Cruces, and perhaps we were going to be partnering with either NMSU or maybe Burrell to be able to do that testing here locally. Did that ever come to fruition, and what does that look like? To be able to run the tests here in Las Cruces.
Councilors Abetes Duve, Mr. Mayor, City Council members, this is Dawn Sanchez, Public Health Division, Southwest Region Director. That we are still working on working with the facilities at NMSU to support them. I know that is at the Secretariat, and I'm pretty sure it's at the governor's level as well. I will definitely follow up with Secretary Kunkel just to see what the status of that is. But that definitely, I think there's intention to support that work locally as well to expand the lab capacity in the southern part of the state. So I will definitely follow up on that point and respond back to David Maestas for you all.
Thank you. I think as we move forward, I've been a strong supporter of being able to have those capacity levels here in our community. You know, as we see cases go up, as things get busier, I'm concerned if we aren't able to kind of, I would say, do everything in-house. I want us to be able to test here, trace here, run the tests here. That way, in case there are capacity issues in other parts of the state, we can still move forward and provide those services for our community. And so I think that's something that I hope can get done and well before we start getting into, flu season and the winter. So thank you, and thank you, Mayor.
Thank you, Councilor. Mayor Pro Tem Gandara. Oh, before we begin, for those of you, the speakers, Dr. Torres, Dave Morgan, Don Sanchez, thank you very much for your formality, but just you're more than welcome. Just say Don Sanchez or Don, and then just, you don't have to tell us your title again. We've got that, and you can just jump on in. You don't have to, like I said, I appreciate the formality, but you can just go in and answer questions. Mayor Pro Tem Gandara.
Thank you, Mayor. Thank you, Mr. Morgan, Dr. Torres, Ms. Sanchez, for participating. This has always been one of the more important areas, I think, for us to ensure that we have you all here to update us. I appreciate Councilor Vasquez and Councilor Subi. They asked a lot of the questions that I had, but I wanted to clarify some things around number of testing sites here in Doña Ana County. You made mention of many, but I understand that there were others like La Clínica de Familia and I always confuse Miss Angel's group. I always want to say St. Luke's, but I know it's not that. Amador Health Clinic. List them for me. I think it's important that the public know where they can go. Would be helpful.
Don, you might, this is Selena Torres. You might have more information, but I know that in the Southwest region, at least the Las Cruces Public Health Office and Memorial Medical Center is what I have on my list today for testing sites. Don, do you have more to add to that?
Correct. Thank you, Dr. Torres. Yes, we have, so it is Memorial Medical Center, Las Cruces, the health office there on Solano. And then Pathology Consultants is the private lab off of Telshore, provides testing as well in the morning. As far as Amador, Councilor Gondara, they do provide some testing. They also do some, working with some of their specific population, working with the shelters and what have you in that area. So they as well do testing, I think, for specific populations right now. They're pretty limited in their capacity to do any kind of broader community, surveillance type testing. So the main testing facilities right now in Las Cruces that I'm aware of, and I think David alluded to CVS, I'm not sure if the private pharmacies are doing some testing too, but right now we have the Solano building Monday through Friday from 7 to 9 a.m. and you can register online through the CV let's see, the website is cvtestreg.nmhealth.org. So folks can go ahead and register online, and with that, you get a confirmation code. It also, one thing that's happening is when people register online, it is showing dates when they're available to come get tested. And I think that it's showing like a week away, but they can absolutely go any day, to be honest with you, and just bring that code with them to get tested at our facility. And then again, Memorial Medical Center is testing right now. Same thing, 7 to 9 in the morning from a Monday, Wednesday, Friday through the middle of August. And La Clinica de Familia at their Central Medical Clinic, they test there on Mondays. And I can't tell you the date, but the times, I can definitely get that information to more specifics for you all to share.
That would be great and helpful.
Sure.
I do want to say I've been in a number of meetings with Pam Angel, and you're absolutely right, Don. They're limited to certain zip codes like 88001. I know specifically I'll have to go back and look at notes. And for very specialized groups, obviously Community of Hope, they're doing a lot of stuff for our farm workers, going to sites and testing them there. And if I can get through my notes, I will send out the zip codes that they have specifically been allowed to provide the service. They're also in the process of communicating with the feds just to loosen up some of their requirements to be able to open it up a little more. Okay. Can you talk to me about the spread rate? How many, if one becomes COVID positive, what is the spread rate looking like currently? How many would they affect? I didn't get that from everything that you spoke of. Does that make sense?
Yes, it does. This is Selena Torres. Yes, so what we call that the R effective, and basically what it means is for every person, then you have, the number tells you how many other people we predict they would infect. So for the Southwest region it's 0.9. Yeah, so it's below 1, right?
Yay. Okay. Hopefully we can keep it there, maybe lower it. Did I hear correctly from Dr. Grace that someone asked, I think Councilor Abeyta-Stube, about sort of you talked about Dr. Torres workforce clusters, like where you're finding them, and I thought I heard Dr. Grace say restaurants 18% is where people are, or where you're seeing COVID. Is that accurate? And could we get a possible percentage rate here in Doña Ana County, or how would we go about doing that?
David Morgan, spokesperson, Department of Health. So restaurants are actually the oversight of restaurants is overseen in New Mexico by the New Mexico Environment Department. Right. So it's very unique how we are overlapped in terms of our services. But what they have found, and also within the New Mexico Environment Department, is also the state OSHA office for occupational health and safety. So they do look at restaurants on a regular basis, and what we did find at the point where the governor decided to cap the customers being allowed to sit inside restaurants came because of an increasing number of rapid responses that did have to come statewide at various locations around the state. I don't know a specific county number for us or a number for our specific city. And this is not to say that it was all restaurants at all either. Still, when you look at healthcare, when you divide up our rapid responses per sector, healthcare still exceeds restaurants. But by the middle of July, we're still seeing a high number of rapid responses that we had to do for restaurants. So what I'm trying to say at this time really is that, while I can't give you the exact number, I can tell you that every response is a rapid response. We are working with the facilities about ceasing operations temporarily and committing to getting people retested is necessary, disinfecting workplaces, and implementing a safety plan on that. But there is also a growing body of scientific evidence that COVID-19 may actually be airborne, and that really just takes our social distancing to a whole different level. If it is airborne, then it is potentially there when we are out walking. It is there when we are in a restaurant trying to enjoy a meal. There were a lot of factors that went into that.
Thank you, Mr. Morgan. I guess for me, I think it's important, as much data as we can have about those types of things in terms of where we're seeing the spread specific to our county. The more helpful I think it'll be for us to continue to manage and monitor that. I think those are things that when you all are meeting on your daily calls, those are things that I think are really important to talk about. I don't see a lot of consistent information and a lot of people not showing up to those meetings. I mean, I'm reading those things because all of you that are sitting here are representatives, and we have people from the Las Cruces city of Las Cruces there as well. I think it's just very important that you continue to give us as much information that you can related to the R effective rates and where are we seeing this specifically in our community, because as policymakers we're trying to we're trying to make policy for the protection of our entire citizenry. So I think I understand what all that, and that there's just so much that it entails. You guys are so busy, and I don't want to sound ungrateful. I'm very grateful to everything that you do. I'm a huge proponent of Department of Health. That's where I started. I got my start. So I understand what you do and what the barriers are there. But as much information that can be given to us regularly, I think the better. I'm also would like to recommend, I think Councilor Vasquez talked about this, spoke of this specifically, but anything that we can do to work on public service announcements with Department of Health. We did a whole mask up thing, but things that in terms of maybe these are the numbers that the contract tracers are using. If you get a number, a call like this, maybe you need to answer or whatever, we'll be texting you. I mean, just trying to get as much information that we can out through our PSAs and our communication office, the better. I'm also asking David Maestas, I know that there's still a number of our employees that are working from home. I'm not sure to what capacity or not. And I'm wondering if there can be some maybe they can help Department of Health with this contract tracing and calls and maybe get trained up for something like that. I'll leave that to Mr. Maestas, but I think that would be so helpful to the Department of Health that we continue to use our employees, utilize our employees to the best of our ability to help the Department of Health with this contract tracing. I know this is an administrative function, but just trying to think outside the box when you hear the numbers of, you have 250 people trained and we need 600 total. I think there could be some numbers in our employees that, that could help in this endeavor. So again, thank you so much for all that you do. I think, Mayor, that's at least most of my questions.
Mayor Pro Tem, that's an excellent idea. I know David's wants to make a comment, but and I understand where you're coming from, but that is a policy issue, and I think that's something there that we could probably easily support. Anyway, so David, Maestas, you want to comment?
Yes, Mayor, thank you. David Maestas, Interim City Manager. Mayor Pro Tem Gandara, several of your items, especially with respect to information, one of the things that I can do differently than has been done before, you might recall quite some time ago, I sent a link, and that link was directly to that presentation spreadsheet that Department of Health has on their website, and it shows the R value and different rates that they're looking at throughout the entire state, and has quite a bit of information for our county and for the Southwest region. What I can do when I health with that way.
David, we're having a hard time. We're having a hard time hearing you, David. So
okay, very good.
If you want to take the video down, and then there you go.
Yes, sir. Very good. I don't miss anything. So there are some links to the Department of Health website that has information on R values and those specific items that council is asking about. What I can do is every time I send out the link for the the report from the multi-agency coordination group, I can send out these links as well. So you'll have the information both from our multi-agency coordination group as well as the information from the Department of Health that you can easily access. The other thing that David Morgan has been very good about is sending us updates on locations and testing times when they come through, either on a week basis or bi-weekly, depending on when they have them scheduled. I can include that in that email that I send to council as well, so that you have that information. We do post that on our COVID button, but this way you'll be able to see it quickly. And it'll also give us the opportunity to remember to send a reminder out to the community when we post it as well, to let them know here are the additional locations and times that they can go to. Hopefully that will help with the information being passed on to council and help you with the questions that you might have. And then with respect to assisting the Department of Health with testing, we have done that. Our fire department did have staff assist with testing locations throughout the county, throughout the community. So yes, as Mayor pointed out, with respect to administrative or policy review on that, we can look into that. And if the Department of Health needs it, we can get with them for assistance. Thank you, Mayor.
Thank you, David. I'm not talking, I think the testing is great. I'm talking about the contract tracing. I think is.
Yes, ma'am.
We have a number of employees that are home. I don't know what capacities they're at, and I don't think they're at 100%. I could be wrong, but I think if we can really partner with Department of Health to assist them in reaching those numbers would be helpful. I appreciate the links. I have those links and I have gone on. It's more about the contract tracing, the percentages of where we're finding, are there workforce clusters? Where are those clusters? Those are all really important things that I think we should have at our fingertips. And I don't see those from the communications that I'm receiving. I could be wrong, but I'll stand corrected. But
Councilor David Morgan, the Department of Health. I think moving forward for these Q&A sessions, we need to bring New Mexico environment into the mix. So you are able then to be able to get that county level specific data that will come with workplaces where cases are occurring in the workforce and so on. So I will work with my counterpart in the environment department to see about bringing somebody in for the next one.
And Mr. Mayor, Councilor Gondra, I think on David's note, this is Dawn too. I think even the Environment Department website, they have listed on there the rapid responses, and it's updated daily. So you can go on there and you can see exactly in which county throughout the state there's been a rapid response. So that might give you another idea, a snapshot of where the positives are happening, and it's pretty much widespread under all industries. So, but that's a place to go and just see what's going on within. It has Doña Ana County, and I think that David Morgan sent that to David Maestas to also share. It would be a good website as well. Plus, I think having some from an environment, like David mentioned, would be a good opportunity to ask them some direct questions. Thank you.
Mm-hmm. Thank you. Okay.
I appreciate that. I think that's super important and maybe something we should be adding to our website. Did I hear that, David, that said it's on the COVID website currently?
What Dawn was referring to was the Environment Department's information that they post. And I did send David Maestas that link this morning.
That's perfect. Thank you, David Morgan. Thank you so much.
Yeah, thank you. Let's see here. Councilor Bencomo.
Thank you, Mayor. And thank you to the Department of Health staff who have joined us. I'm sorry to have seen Dr. Landon retire, but I guess if I was him, I would also retire in the middle of a pandemic. No better time. Thanks, Dr. Torres, for joining us. And thanks to my colleagues for the great questions. As we move forward, my question list gets shorter and shorter. I have sent over a question through Mr. Maestas last week regarding actually what Mr. Morgan just mentioned, and I'm wondering if you, Mr. Morgan or Dr. Torres, can talk more about the aerosol transmission of COVID and the dangers of that, those findings, that data on this threat of it being airborne, particularly in enclosed spaces. So I'm hoping you can touch a little bit more on that.
Dr. Torres?
This is Selena Sutters, yes. So, you know, there's lots about this virus that we don't know, and it's ever changing. So the things that we do know is, as you mentioned, you know, in enclosed spaces, the risk of transmission goes up. We know that the transmission mostly occurs person to person through these droplets. There is evidence that if droplets are on a surface and that high touch surface is touched by somebody and then they touch their nose or their mouth, that then they, can become infected. As far as percentages of how often this happens or in what, with certainty like this, if these many people are in this space, it will occur. We don't have exact numbers. I think the best way to view this is as, the number of, the amount of risk. So within a closed space, with a crowding, with people not wearing masks, that's the greatest risk. If people are masked, then the risk goes lower. Then if people are distanced, then it goes lower. And then if people are not within an enclosed space, then the risk is even lower. So it almost needs to be looked at as, what level of risk are you putting yourself in? We know that none of the interventions we have are 100%, but we know that in combination, these interventions lower our risk significantly. So, in an ideal world, everybody would adopt all the interventions, but what we can hope for is that most people adopt most of the interventions, and then we get the best, the best mitigation possible. I hope that answers your question. It's a little vague, but the data is not there yet.
No, I understand. Thank you, Dr. Torres. I just recently read an article on the New York Times about this aerosol spread, and definitely wanted to touch base with you about it. And I'm sure your tired of repeating those simple steps people can take to protect themselves and others. But the more we repeat it, I think, honestly, the better. So thank you for that.
Absolutely.
I recently read also an article here locally about the press conference Dr. Secretary Grace had a couple weeks ago or last week, I don't even remember at this point. But he had talked about the pattern that there are more asymptomatic people testing positive. Is that right? And can you talk about that pattern? I think he'd said that was a positive trend. I'm curious if you could expand on that.
Sure, Selena Torres. This is Selena Torres. So, yes, we are seeing an increase in individuals that are testing positive, that are reporting to be asymptomatic. And a lot of this gets into, there are people that are just definitely symptomatic, and whether or not we are just identifying them earlier in their course of illness, and so they have not developed symptoms yet. That's one possibility. The other possibility is that, depending on the quality of our interview with during our case investigation, some people are willing to give more information than others. So we could potentially be overestimating the number of asymptomatic individuals. However, we don't believe that to be true, but that is a possibility. And then the other trend, which is most likely, is, we're seeing that we know that younger individuals have a different and less severe response in general to this infection than older individuals. And so since our numbers are going up in that age group week by week, it makes sense that we're also trending with an increase in the number of asymptomatic individuals testing positive. So it all kind of sort of fits with those puzzle pieces, but we don't necessarily go back and interview these people, after we've done the initial case investigation. So it could be that they later on do develop symptoms. We just have not, we don't have the capacity to do that at this point.
Okay. And then 2 follow-up questions regarding that particular issue on younger people and asymptomatic folks. Can you help clarify what the reasoning then behind is for some locations to stop testing folks without symptoms, given the current trend in rising of those particular cases? And then my second question is, this trend of the younger folks, 20-year-old range, is that just here and doing New Mexico, or are we seeing that across the country?
Selena Torres again. So yeah, the trend, I believe the trend is across the country that we are seeing an increase in the younger age groups. And I think it also has to do with the younger age groups are the ones that are most likely to be also out in the workforce. They are doing the jobs that still require individuals to be at a workplace. So that would explain some of that. As far as the reasoning behind our partners not deciding not to test asymptomatics, I think it's more of a prioritization, and they're doing this because of the capacity that they have to process the specimens and get results out in a quick manner. So as David mentioned, in an ideal world, we would test everybody whenever we needed to, but I think that is the prioritization. And it's a good point that you bring up that asymptomatic carriers are most likely to spread the most because they are walking around as though they are, interacting with the public as though they feel that they're not infectious. Which just brings us back to the same point we keep talking about over and over again, which is reiterating to the public about, the safe practices that we can all do. It would be great if everybody walked around acting like as if they had it, because that would probably, decrease everything significantly. But of course, we don't want to cause mass panic either. So it is a good point that you bring up. And ideally, if we could test more asymptomatics, that would be great. But it's kind of the situation we're in.
Yeah, absolutely. So, but you don't foresee the Department of Health moving in that direction at all, right? And not testing.
Right. So
symptoms.
Absolutely. So as it stands currently, we're still testing. We haven't changed our testing prioritization or capacity. that remains as is. We will continue that as long as we can.
Great. Thank you for that. I hadn't looked at the dashboard, the online dashboard, in quite a while, probably honestly because I was too scared to. I keep seeing the governor's daily updates, and I don't remember the last day Doña Ana County had numbers in the single digits. They've been pretty consistently 20 and above every day. But I noticed, early on, March, April, May even, our biggest concern were Sunland Park, Anthony, their cases were just spiking. And I just looked at the dashboard by zip code, and my particular zip code is close to the number of cases, positive cases, as Anthony and Sunland Park. I mean, we're probably 20 behind. I'm curious about if you have any thoughts regarding, obviously Sunland Park, Anthony, maybe they're doing something right? Like they've seen perhaps their numbers stagger off. Do you think that's accurate? Are you looking at Doña Ana County that closely? If not, is that something that we can do locally?
Councilor
Yeah,
David
this is
Morgan,
good.
certainly one aspect to the case numbers within your zip code would also be the population living in your zip code. If you have, people in their 20s and 30s there in large numbers, that is where we are seeing the largest number of cases right now. Useless and also sad trivia, the last time we were at single digits for new cases in Doña Ana County was on June 23rd.
Also, David, on July 1st, we had 8. So,
very good.
Yeah, I have my policy analyst tracking it as well. So just thought I'd throw that out there.
Thanks. That seems like forever ago. Thank you for that, David. Dr. Torres, did you want to add something?
Yeah, I also, this is another challenge that we encounter at the Department of Health is correctly assigning people to where they actually live. So, we're working on getting people to, list their correct address, but, I don't know if you've noticed in the press release, for example, there will be corrections to each county each day. And so, somebody has an El Paso address, but they also have a Las Cruces address. And so we identified them as a Doña Ana resident, but then when we did the investigation, realized, no, they're not a New Mexico case. So those things change day to day, and zip code also changes day to day. So it's great to watch it. And I think it's important for situational awareness for your communities, most importantly. But, there are these caveats about identifying, making sure that we have the correct residence address for individuals. And, until we do the investigation and talk to the person, do we get a real location of where they live? Of course, everybody has complicated life situations. Like we're staying with my aunt in Las Cruces, and then I got sick. And so I've been here this whole time, but I actually really live in El Paso, or, I work in Las Cruces, but live in El Paso, and I put my friend's address because I wanted to make sure that I got the result. And so there's a lot of complexity to the case counts, and that's been the thorn in my side for this whole pandemic. And I've spent countless hours assuring that all county counts are as accurate as we can make them. And so, I'll just say that it is, you have to take it with a grain of salt when you look at those especially zip code level data.
Great. Well, thank you. I appreciate your diligence for sure on that. And maybe my last, I do want to point out that I very much agree with Councilor Vasquez on our prison facilities, whether they're state, federal, or ICE detention facilities, and just what a travesty that's been. And obviously not on the Department of Health, right, but just maybe generally in the criminal justice system, how poorly we've taken care of people who are detained. And so I appreciate the work that Department of Health is doing to ensure people are being tested and taken care of. My last point/question is around workers. And I think my biggest fear is that we're seeing more and more people who are essential workers, perhaps working in food production industry, whether it's meat packing plants, onion sheds, agricultural fields, the dairies in the South Valley, that there are a lot of folks who are afraid to get tested because they're going to be asked to stay home for 14 days, or in some cases, what I've heard is that they're being fired for testing positive. And, my fear is that more and more people will be really afraid to get tested, regardless whether even if they have symptoms, and that they're just going to keep showing up to work because they have no other source of income for their families, thus increasing the risk of spread. And so I'm curious about the coordination that the Department of Health is doing with the Department of Workforce Solutions to ensure worker safety, workers' rights are being protected, and that that we're telling workers that it's okay to go get tested, especially if you have symptoms, and that your rights are protected. So I'm curious if you can talk a little bit about that coordination with. I know that you mentioned the couple other departments, but I'm curious specifically regarding workers in the Department of Workforce Solutions.
Yeah, David Morgan, Department of Health, Councilor Bencomo. This really underscores, I think, the importance of being able to have New Mexico environment, where is New Mexico's OSHA team is housed, added to the mix to these meetings, because what you're speaking of falls into the overlap now between environment and workforce solutions. We don't have a direct role in that, but we have been available in the past for consultation with the Department of Workforce Solutions, and we still are. We do communicate regularly, but specifically what you're looking for there, that is going to be in the realm of those two agencies.
Great. And then do you know, Mr. Morgan, what sort of the oversight looks like for some of those larger employers? Like I said, like some of the some ag industry, dairies. Are you visiting, doing an investigation into those employers only if someone files a complaint, or is there sort of a blanket oversight strategy for these industries that have a lot of employees in one place to ensure that they're taking care of their workers?
Yeah, absolutely. It is usually a positive test result that sets the ball in motion for the Department of Health with the environment and New Mexico OSHA involved. What that also leads to is additional conversations, not just the underscoring the importance of letting the Department of Health in to be able to test all your employees, but they are also guiding them with regards to, you need to be able to cease operations immediately. You need to get some retesting done. You've got to disinfect your workplace now, and you've got to be able to demonstrate that you have a safety plan for this moving forward. This is something that we've developed together with our combined agencies, and it is proving to be effective up to now.
Great. Thank you for that clarification. I think I will perhaps follow up with Dawn regarding some of these concerns I have, but I'll email her offline. And I really appreciate all of you for being here with us and for answering all of our questions. Thank you, Mayor.
Mm-hmm. Thank you, Councilor Sword.
Thank you, Mr. Mayor. Yeah, a lot has been discussed already, and I don't want to take too much extra time up, but there's a couple of things I wanted to say. But to start with, I am awesome that the three of you are from the Department of Health are here with us today, and thank you so much for taking the time to be with us and answering our questions. First of all, let me tell you a real short story. I was on the phone with a teacher who happened to be from Valencia County, who was telling me how she took a test on a Friday. This is just a week or two ago. And I was talking to her on a Tuesday, and she hadn't gotten her results yet. And so that was concerning me, and I was wondering how we are here in Doña Ana County on getting those results back. And I'm I'm glad that question has been asked already. I would just say this as concerning that if people who were getting a test were told that if they were going to have a positive test, they would be told within 24 hours, in 24 hours, should say, and that if they didn't hear anything in 24 hours, they most likely didn't have a positive test. That would have helped this teacher in Valencia County. But anyway, I would like to emphasize the fact that we need to get this information out to the public. Things such as the online registration for testing. This is the first I've heard of that. And other things like where to be tested, when to be tested, how to be tested, and all those things that people should know. If we could have a news release by our PIO that we could spread through social media and other media, I would be really appreciative of that. And David, you're doing an awesome job there at the Department of Health. You're so knowledgeable, and you give such great information, and I'm just really impressed. So I won't belabor anything more, Mr. Mayor. Let's move on to the next counselor. Thank you.
Okay, well, thank you. Thank you for being that role model there, Counselor. Counselor Vasquez looks like he has another comment.
I don't, Mayor. I apologize. I forgot to put my hand down, so I'll do that.
Okay, no problem. No problem. Let's see, Counselor Flores.
Thank you, Mr. Mayor, and thank you, Dr. Torres and Ms. Sanchez and David Morgan. Thank you all so much, and thank you for your work at this time, and always, of course, Department of Health. We don't have our health, we don't have anything. So thank you very much. I am concerned about a couple of things. One of them, first and foremost, the detention centers, and there might be others in the state I'm not aware of, but are down here. And we have to be concerned about the entire state, not just the entire world at this point. But germane to us is the detention centers here that are federally run. Federal jurisdiction, I should say. They're privately owned. But I know the governor in California, I just saw a little thing on CNN because I've been admonished from watching CNN too much by my beloved Mayor Pro Tem Gandara. But I believe I heard Governor Newsom say that he was going to release a lot of prisoners. And we have, with all due respect to the office, we do have a rogue person in the at the White House, and I, what are we prepared to deal with an onslaught of release of federal prisoners here in New Mexico, because those seem to be hotspots for the COVID infection. So that's my first question. Do you have an answer to that, any of you? Has it been something you've talked about or anticipated? Is the answer no? No one has thought about it?
So you're talking specifically federal prisoners, Counselor?
Well, I'm talking about the impact. Yes, well, federal. I'm talking in.
Because I haven't heard of anything like that.
Well,
seen federal prisoners.
Well, yes, I am talking about federal prisoners, Your Honor, and the reason is because we do have that potential going on right now in our state of having federal troops being sent to Albuquerque. And again, being that we do have a rogue president of the United States, I'm afraid that he's just going to willy-nilly say we're going to release all the federal prisoners because of COVID. I mean, I'm just saying, are we prepared for that? And since there was no one jumped to answer that, I'm going to presume or deduce that that possibility hasn't been considered. So I'm sorry that no one has thought about that.
That's a good deduction.
It's a deduction.
I said that's a good deduction.
Yes.
This is Selena Torres. I will just say that
the jurisdiction of federal prisoners, it does not fall under the Department of Health. So, I mean, we have been in communication with correctional facilities about protecting the health of the inmates and detainees and the staff. But as far as the, policing of individuals that are released, that would not fall under the Department of Health. So I'm not sure, David, if you have any other information related to that.
I would not have any information related to that. Councilor Flores, though, I would definitely say the answer to your question is more political than it is medical, and it's something that the Department of Health wouldn't be able to directly address.
Okay,
This
but
is something
Mr.
that would need to be addressed directly from the administration itself.
Oh, the governor's office?
Yes, ma'am.
Well, I certainly agree to Dr. Torres's response or reply or comment, and yours as well. It is political. Everything we do is political. The color of the red food coloring in your velvet cake is regulated by the FDA. Every decision we make is, somehow has a tangential connection to political decisions made, that are out of our control. My question is, well, it looks like it's something you're not anticipating. I'm just saying, in the event there'd be a release of, say they were all pardoned, they are now within the jurisdiction of New Mexico. They are no longer under the federal jurisdiction of the prisons. I'm just saying, the reason I'm saying that is because the governor in California made that announcement. I haven't followed it up to see if he's come through with it, and I don't know how California is going to deal with it, but I'm just saying that if there's a governor somewhere saying he's going to do it, I'm not saying that our governor would do it. I'm just saying that it is a possibility. So I just want to raise that as a concern. The other concern I have, and it was addressed by Mayor Pro Tem Gandara, is to find out exactly where these clusters are. And the reason for that, and again, we're touching on a political issue. You know very well, Mr. Morgan, and we have the Restaurant Association very upset because they believe that there isn't a problem. They want to serve, they want to serve, they want to serve. They had a demonstration or a protest or whatever it's called that they had just about a week or so ago. And then the governor came down. So I would like to know, we have clusters insofar as, getting addresses from people. When people are tested, are they asked where they are currently working?
Yes, place of employment is a question that we do ask.
Okay, so then you would have information, data that you can extract from that to see where people are employed, and then that information could be then fed into a column that shows that they are employed in this industry or that industry. And it seems to me that based on everything that's been said this morning, it confirms again stuff that we've been hearing now for months and months, that enclosed areas are potentially more dangerous or contagious. I mean, it's more of an environment to get that airborne contamination infection. So would it be possible to get that information?
Councilor Flores, Councilor Flores, David Morgan, Department of Health. Again, this is a question that underscores, I think, the importance of being able to get our colleagues from the Environment Department involved in the mix for future Q&As.
And I think that's an excellent idea, David. And I hope, Mr. Mayor, if we can possibly have a meeting next Friday or sometime soon to have OSHA and the Department of Environmental, New Mexico, well, the Environmental Department that oversees restaurants. We need that data because it seems like, again, as David pointed out, he said something was political and everything has become political. And it's kind of like the us against them. And as Councilor Bencomo said earlier, it's everything has been so divisive. Everything, it's me against you, you against me, and it's broken into political parties. And people don't understand that we're in this together. And yes, we can say that, glibly, but in fact, it's something we really need to look at. And so those are and the other and Councilor Sword touched on
Councilor
this.
Flores?
Yes.
Can I just add to that? This is Leah Torres. I just wanted to bring one point that I think is really important with getting employer information is that, we really have to assess if the individual worked during their infectious period. Because if they did not work during their infectious period, then there's no reason to scrutinize the place of employment. So it's a little bit tricky when we ask somebody to register while they're getting tested to give their employer, because, that's just like, oh yeah, that's my employer. During the investigation is when we identify if there were actually exposures at the workplace, and then we need to do further, take further public health action. So I agree. The data is very important for the community to be able to, have it handy and use it as data-driven policy changes and actions. But there are some caveats that you just need to be aware of.
Yes, and I understand all of that. And there's a lot of, and that's why when data is collected, there's always those percentage points that are, you give room for those percentage points where you may be off insofar as the results. So thank you, Dr. Torres, for that. As far as getting the word out, David Morgan, you have a wonderful presence, a wonderful voice. I think, and I've been saying this since I've been on the council now, that Las Cruces doesn't really get, excuse me, we do get the FCC requirement of being aired by El Paso stations. And is there any way, Dr. Morgan, that you could, or Dr. Torres, or the Department of Health, or Ms. Sanchez, to be on get spots on the local stations that air the city of Las Cruces or Doña Ana County on a daily basis? Get like a 1-minute spot to just do a quick report, or a 2-minute. I think it would be great for us to have that. First of all, have that presence in the lives of people, because I think that a lot of our residents don't have access to what we're talking about right now, because they don't have a computer in the house. But most people have a TV, and the local stations, ABC, CBS, and NBC, KRWG airs a lot, but a lot of our stuff. But to have those national, and they pick stuff up too. So I would make that request, Dr. Morgan, if you could do that. And then I have a question about the CVS and other non-DOH facilities conducting the testing. Is there any oversight as to what they do by the Department of Health, or how does that work?
Councilor Flores, independent medical entities can, they do their own thing in terms of process of being able to collect the samples, where they send the samples for actual testing. They also make the criteria for testing for their individual locations. So some people may ask for a driver's license. Some may actually ask for immigrant status. These are not things that we ask for example. With regards to the actual testing, one of the lab partners that we have utilized, that's been kind of hand in hand with us throughout this process is Tricor, which is based in Albuquerque. And that is where the vast majority of actual testing is done. That is where the majority of sample results from the state go to, is between those two different labs. Those two particular, that Tricor itself specifically is jointly owned by Lovelace and Presbyterian Hospital Systems, which really do dominate the marketplace up there in northern New Mexico. So, we all are working towards the same goal of being able to test people, to be able to find out the results, to do our part collectively to minimize case numbers and slow the spread. But there is not a specific guidance that a health department delivers to private entities on a subject like this.
So, you just mentioned that they ask for immigrant status. For a lot of people, that would be a deterrent to getting tested. And if they, and then there might be people who don't know that if they go to CVS, that they'll be asked. Is that information out there for the public to really understand? I just found out about CVS testing right now. So,
Councilor Flores, we do have on our COVID website a clear place to go for a directory of testing services around the state. You can look it up by your city. You can look it up by a specific day. And any location that is listed that is not a Department of Health location does also include the disclaimer of testing criteria could be different from location to location. Questions that you could be asked could be varied by location to location. So, if you are not reaching out specifically to a Department of Health location, we certainly do encourage people to call ahead of time to be able to know what they need to bring, what the testing criteria is, and so on. For the Department of Health right now, our goal remains being able to test as many people as we can.
Absolutely. Thank you, David. And is it, how should I say, would it be, I don't know what the word is, kosher for you to, for the Department of Health to alert people to the fact that some of these non-DOH testing facilities might be asking for their immigration status or their immigrant status?
There is a lot of discussion going on about external messaging that the Department of Health will be doing in terms of campaigns on television, radio, social media, and that is one of the things that is being discussed. But it is a message that we certainly openly communicate.
Okay. Well, thank you very much again, and David and Dr. Torres and Ms. Sanchez, thank you very much. And Mr. Mayor or Mr. Maestas, it'd be great. I think, Mr. Morgan, you indicated that you'd be contacting either the mayor and or Mr. Maestas about getting the environmental department in, and perhaps we can have OSHA as well.
Yes, I will be working on that.
Great, thank you. Thank you again very, very much for your work, all three of you.
Thank you.
Mr. Mayor.
You're welcome. Councilor Beta-Stubbe.
Thank you. I have an additional question regarding hospitalizations in our area. How are we doing? Are we seeing those increases? Are we seeing more cases from southern New Mexico? I know that we had to act as kind of a hub station for other southern regions. And are we seeing any individuals from El Paso needing to come up here? I know there's a lot that are coming up for testing. Are we seeing that reflected in any ER cases?
Counselor David Morgan, Department of Health. I am unaware of, whoops, there we go. My apologies. My screen completely changed in mid-sentence. I am unaware of any patient transfers from Texas into New Mexico. We have received patients in northern New Mexico, in Albuquerque hospitals, from Arizona as needed. That said, though, we get the data regularly from our hospitals across New Mexico, to include within the county as well. So, we are always aware of bed count. We are aware of number of ICU beds. We are aware of the number of ventilators in use. And we have had, while the cases have gone up, and we've had younger people having COVID, affecting disproportionately people in their 20s and 30s more, that has led to, for now, a decrease in overall hospitalization. And I also know that El Paso County's ICU capacity, while they continue to have increased cases, and they do continue to have increased hospitalization, they have not reached a level of capacity that has been any threat yet to Doña Ana County and Las Cruces.
And I don't know if this is something you're able to share or not. Are you able to give us what Doña Ana County's capacity is at right now?
I am actually attempting to look that up right now. And Dr. Torres, I think you started to say something and I talked over you.
That's okay, David. I actually was just going to say I do know how many Texas residents we have had hospitalized in New Mexico, and it's very few. This was as of last week, and it was less than 2% of our hospitalized cases were Texas residents. So it's not a big amount, and I will say that we have a good proportion of our hospitalized New Mexico residents that are hospitalized in El Paso. So, just for context, we are having some of our New Mexico residents hospitalized in El Paso.
Thank you. And when we look at that capacity, and I know it's not just about you can have a ton of beds, a ton of ventilators, but staffing is always an issue with that, and especially if you do get those high acuity cases. How are we doing on staffing, and what is the plan if we do have staffing issues to bring in, I guess, other nurses, doctors, specialists that might be needed in this area?
So staffing is not reported to us. We don't keep a close tab on staffing within the hospital. And I know that early on in the pandemic, we worked with hospitals and the Hospital Association to create the word is escaping me, but it's the pandemic plan. And what you would do, we have, steps and phases, and one of them is crisis standards of care and how you adjust based on surges in patients and then potentially loss in staff. And so a lot of the facilities have plans laid out on how that will, what they will do. Should they enter one of those phases. But David, you might want to speak more on staffing if you have any information on that.
Yeah, my apologies for being slow on the unmute button. David Morgan here, Department of Health, Councilor Abeta Stuve. In addition to the need for medical staff is always an issue for New Mexico. But in addition to that, we do have that is housed within the Department of Health, the Medical Reserve Corps, which does have a great number of backup medical people that are willing to step in. We had our Medical Reserve Corps numbers swell last year when we went through the migrant surge. We needed to rebuild that infrastructure, and we had people come through by the hundreds. So That's not to say that the Medical Reserve Corps is the perfect solution for the scenario that you described, but I just want you to know that at least there are options out there.
Thank you. I do appreciate that. And this might also be something for Mr. know if there's plans, in our southern region, we are able to have a lot of different care capacities, but I do know sometimes we don't have the same technology that even Albuquerque or El Paso does for those high acuity cases, things like ECMO machines and things. Will we be able to bring those types of resources down here should we need? Has there been any thought to being able to bring those types of machines and staffing to help patients that might be seen in the southern region? Because I know with this disease, it can move very quickly. And when you have unstable patients, I think it would be hard to get them transferred up to Albuquerque or El Paso to get that level of care if need be.
Councilor Beta-Estuve, David Morgan, Department of Health. I'm not really sure who specifically the question was directed at. I can only speak to on the Department of Health front. We do, along with the Department of Homeland Security and Emergency Management for the state, even working with the National Guard, we do have ventilators. We do have additional medical equipment that is in a stockpile that is there, ready and waiting in the case of a surge. They remain in the stockpile right now because even as the cases are rising in the state, we are at least able to mitigate any potential for surge up to now. But that stuff is there when we need it.
Okay. And how long would it take to deploy that equipment to Doña Ana County?
I am not positive on the time frame, but when we're talking about emergency management services, we are talking about a very fast turnaround. We are only at the end of the day, all of us here are only a few hours away from Albuquerque and Santa Fe.
Fantastic. Okay, that's good to hear. I think it's just something that we need to consider, making sure that our residents can get that level of care if they need to. And thank you, Mayor, that's all. And thank you, everybody, for answering so many questions from us.
Okay, thank you. Councilor Bencomo?
Thanks, Mayor. Sorry, just really quickly, I want to address, I don't want to leave Councilor Flores's comments on the release of folks who are incarcerated sort of hanging. The governor of California definitely is releasing a lot of folks who have been unjustly incarcerated for a long time. So this is not violent offenders. This is people who have been in prison for an unjust amount of time, and they're actually looking at the way the justice system has harmed people, and no better time than during the time of COVID to release people from a place that frankly doesn't care about people's health. And so I just wanted to point that out, because I think it's important to discuss something like this not out of a place of fear, but out of a place that upholds justice, much like many of the judges here locally have noted. And if the governor moved towards doing something similar, here in New Mexico, I would highly support it. So I just wanted to make that known, because I think the way it was stated, it made it seem like it was just a release of a bunch of folks, but it's very much intentionally folks that have been incarcerated unfairly.
Was that a statement or a question?
No, that was a statement. I'm done. Thank you.
Oh, okay. We have Mayor Pro Tem Gondara.
Thanks, Mayor. These two questions are specifically for Dr. Torres. What is where are we at in terms of a vaccine? What can you tell us specifically? What are you hearing? What does that look like? Time frames, those things, those kinds of things.
Yes, thank you for your question. This is Selena Torres. So, we are very much entrenched in the response and would like to spend a lot of time researching on what vaccines are available and what our time frame looks like. It looks like there is the vaccine coming out of Oxford that seems promising. I think that, there's a lot of promising vaccines, but what is going to be what's going to be hard for us is to figure out how to get everybody vaccinated. And then, as we know, a lot of people do not like to get vaccinated. So there's a lot of logistics. And then also, there's also a lot of resistance to even getting the vaccine in general. So I think even if we have a vaccine in the fall, I'm not sure that we'll be able to roll it out immediately and get everybody vaccinated as we would all like to, so that we can start to see what life looks like past COVID. There is some new information coming out of CDC about reinfection and what that looks like, and also whether or not people have some kind of protection or immunity after they've recovered from COVID. And so some new data suggesting that, it looks like people may have some protection for at least 3 months before they can potentially become reinfected again. So that is good news. We did not know at all if people could become reinfected or when they could. So we were treating any new exposure, even if a person had recovered as if it was an original exposure. So it makes our lives a little bit easier as far as isolation and quarantine protocols. But I think the science is moving pretty quickly, and on the vaccine development front, I think the public health response to it is going to be very, very challenging, especially since our systems are spread really thin and taxed already in the response. We at the Department of Health have employed almost every division to help us in this response. So as you can imagine, they're juggling, our immunization program is trying to figure out how they are going to roll out flu vaccine once the season starts, in addition to still helping us with COVID response. So we have a lot to try to organize and figure out. But, we just keep moving along, and new information comes every day. I'm sorry I don't have anything more specific, but those are the kinds of things we talk about at Department of Health as far as how are we going to implement these things.
I appreciate that. I know there's just so much, it's still up in the air, and lots of plans, lots of discussions, and I'm sure planning that is a part of those discussions. Lastly, my question is about what are you seeing with folks that you touched upon it a little bit about people testing positive for COVID and kind of after immune, if you will, for at least 3 months. But what sort of things are you finding in terms of lingering effects that COVID has? Any medical conditions? I'm reading some things about scarring in the lungs and heart conditions and just difficult recovery. Can you speak to that, Dr. Torres?
Yeah. So, again, this is another area where, as the infectious disease epidemiologist, we would love to be able to spend a lot of time understanding long-term effects of this infection and what that means. And we try as best as we can. Our current response and investigation process does not allow for us to look long-term. The data that is coming out, though, is suggesting that, this is a widespread kind of inflammatory response. And, a lot of the postmortem or, after somebody has died and they've done autopsies, what they're finding is just, blood clots in every single organ system. And so it's nothing that anybody has really seen before, and it's puzzling. And so there are groups that are evaluating this. And, the response is just different with different people. Even in people that have underlying conditions, they might not have as severe of illness as people that are perfectly healthy. So there's a lot of questions still to be answered, and it is on our radar to try to evaluate that. We do work closely with CDC to do some in-depth following of hospitalized cases to get a better sense of severity of illness and what that looks like in our hospitalized cases. My suspicion is that the CDC will eventually expand that to, look at long-term effects. So, what somebody that was, intubated and for months and then recovered and is now out, how long is it taking them to recover? Are they completely recovering? And so, we've done similar studies with other types of infectious disease. So I suspect that that'll be the next phase to roll out with CDC, but we quickly, stood up this study to look at hospitalized cases, and New Mexico is contributing data to CDC, which then gives the national picture of what it looks like in, what hospitalized cases look like in the United States. So we are one of 10 states that participates in that program. And so it's great that we can provide that data. I'm not sure what it's going to look like now that the federal government has decided that hospitals report directly to them. But under this program through CDC, we are collecting extensive information that kind of gives the national picture of what a hospitalized COVID patient looks like and how we can perhaps, identify our greater risk populations and look for some early interventions. We're also evaluating in the hospitalized setting what, the current interventions are doing. So there's a lot of investigational drugs that are being used off-label, and we collect that information as well. It's early on now, and a lot of that data hasn't been analyzed, but New Mexico is contributing to that, which is something we should be proud of.
Yes, absolutely. Thank you, Dr. Dora. Thank you, Mayor.
Mm-hmm. And let's see here. Oh, that's it. Okay. Well, great. Well, thank you again, Dawn and Dave and Dr. Torres. We really appreciate it very much. Thank you for spending your morning with us to share with us and answer many of the great questions that my colleagues have asked you. Again, thank you, and hope to hear from you all again soon.
Thank you.
Thank you, Mr. Mayor. Thank you, City Councilors. We really appreciate all the support and partnership with the city, from your fire to the police department to City Council. So we greatly appreciate the partnership that we have with you all and your interest. So we will definitely be in touch. Thank you so much.
Mm-hmm.
Thank you, everyone.
And last is going to be section 3.2, the appropriations update, and Ms. Natalie Green will be presenting.
Good afternoon, almost afternoon, Mr. Mayor, members of the council. Natalie Green with the City of Las Cruces. I will be presenting a short update, and then there's also some other staff that will be assisting me today. So I will get started. So just an update on the council appropriations. As you may remember, council allocated about $1.8 million. By the end of the fiscal year, we have expended about 51% of that. And then we do have a balance that many of those agencies and departments are still trying to spend. And that funding went to support PPE, health initiatives, food initiatives, housing initiatives, and some economic development initiatives. So an overall accomplishment, staff and council should be proud to know that we helped about almost 1,600 in direct financial assistance. So that was assistance with utilities or housing costs, just general financial assistance. We were also, through our partnering agencies, able to house 255 people. And then we have a number of agencies providing a variety of supportive services. So that's going to be things like Doña Ana's Community United, the 3rd District Court, so things like that. And then in terms of food and nutritional services, we served approximately 121,000 people, and that's in different direct meal services and food baskets, and that is citywide. And then through various efforts, and I'll get into this more detailed in later slides, we've distributed approximately 22,000 masks through different initiatives. And that's going to be not only through our mask ups, but through Cruces Creatives, and then we did some outreach with Quality of Life and some direct assistance to some of our nonprofit partners. For the Utility Assistance Fund, so Council did provide an additional allocation in FY20 of $125,000. They have expended all of that fund. They are currently using their regular FY 2021 fund, and they are continuing to expend that. To date, they've spent about 20, can't math today, but just over 20,000. If we continue to see the trend we are seeing, they're spending about 30,000 a month, so they are going to need additional funds later in the year, or probably sooner than better. And that should be about 100,000. And I believe utilities is available for questions on that. The fire department, there's not much on this slide, but fire is available to answer any questions. They continue to do some PPE assistance. If we get the surge that we are anticipating in the fall, they are going to need additional funding for to stockpile PPE. They are also assisting in doing some food boxes to seniors and checking in with homebound residents, and they can speak more to that if council has questions. We did work with Quality of Life and did a mask up event. It was very successful. So we had approximately 600 or more residents stop on by. We distributed about 1,700 masks, 345 water bottles, and 5,000 sanitation kits that was prepared by the fire department. My understanding is there may be opportunity for some additional drives, subject to some funding to be able to purchase some of that PPE. So that ties in with fire department's need. Senior programs is available if you have questions as well. They've been doing a lot of things. So they have grab and go meals, some home delivered meals. They've been doing some well boxes, food baskets. They're also doing some mask distributions, not only with their mask up events, but to their as part of their regular monthly visits. And then through their transit system, they are handing out masks as well to their patrons. I'm sorry, I'm just reviewing my notes from Lynn. So for the vulnerable populations, they are working with the city and county on the strike team and addressing some of those needs. And they are also partnering with some of our nonprofit partners to help do some food and nutrition services. So those agencies are Casa de Peregrinos, Loaves and Fishes, Adelante, FYI, Sun County Care Management, and Southwest Vocational Rehab and Tresco. At this point in the presentation, I'm going to pass you over to Francisco. Actually, yes.
Yeah, excellent. Thank you, Natalie. Hello, Mr. Mayor, members of City Council. And for economic development, the technical assistance that leads to micro lending, the contract has been signed with Live Fund, and we're expected to launch this on August 3rd. Some of the deliverables included in that are 50 businesses served through the technical assistance. 20 businesses to receive loans and $500,000 in loans received. Natalie, can you move to the next slide, please?
Yes.
There was also a request to getting some of the numbers from the unemployment insurance claims. This data was collected from the New Mexico Workforce Connections. The Doña Ana unemployment claims is the panel on your left. As you can see, at the pre-COVID levels of March, and this is a data that comes on a weekly basis, we're pretty low compared to what happened and at the peak of the first closure. happened. So we were having levels at the beginning of March of between 74 to 80 weekly unemployment insurance claims, to that peak that we observed in the first week of April, the last week of March, of close to 2,000 unemployment claims. That number has been steadily coming down. It has a very similar trend to what the New Mexico unemployment claims look like. And the latest information that we have is for the July 11th week, it's 560, which is still pretty high compared to the pre-COVID levels, but not as high as it happened as the initial closure. Can you please move to the next slide? In terms of change to change on a June to June basis, this is preliminary data that comes from the Bureau of Labor Statistics. The biggest change, as you can see, the red line, and this is for the Las Cruces Metropolitan Statistical Area by industry, the biggest decrease that we had was in leisure and hospitality, as well as, and that category right there includes restaurants as well. So within this, we saw the biggest decrease. There were, as you can see, in many instances, lots of decrease with employment. This is payroll employment, by the way. And there were also some increases, some of those. So there were some increases in transportation industries. There were some increases in construction. There were some increases in a little bit of increases in manufacturing and wholesale. But for the rest, the vast majority of them, there was a decrease. Thank you, Mr. Mayor. Natalie?
Okay, at this time, I'm going to invite Amy to jump on in, and she's going to give you a quick update on the CARES Act.
Good morning, Council, Mayor and Council. Amy Johnson-Basford, Grants Administrator. So the last time that I presented to you, I gave you this beautiful spreadsheet. I've decided to summarize that into a few slides here. First of all, I want to let you know that the city has received in total $7.14 million in federal and state funding for the COVID crisis. And I'll just briefly go through the federal awards that we've received. We received from the FAA for the airport, $69,000. That is for operations. There is no match to that, and that money is available until expended. The FTA, we received a little over $6 million for Roadrunner Transit for their operations. Again, no match. This is very important because normally we have a one-to-one match with our FTA funding. This is available until expended, so it should cover transit operations for the next 11 to 15 months. Then we have the Department of Justice Burn Grant funding. It's Justice Assistance funding is what it's called. This is a allocation of $69,622 for Las Cruces Public Police Department. These are specific for COVID-related expenses, equipment, and salaries. There is no match to this, but it does have a 2-year spending limit. From HUD, which Natalie can speak to if you have questions on that, we received an allocation of $560,000 plus. For community development, she has submitted a plan on how that will be expended. There is no match for that, and that is pending contract execution. All of these awards were based on allocation calculations from the federal government, and although they did require some application process, the amounts were set by the federal government. If you can go to the next slide, Natalie. And then from state agencies, some of the first one is the New Mexico Department of Public Safety. They received some federal money from the DOJ Burn Justice Assistance funding as well. We submitted an application and did receive full funding for that of $151,000. This is also for the police department for specific COVID-related expenses, equipment, and salaries. It has no match, but it does have a 2-year expenditure program period. And then we received from non-metro area agency on aging through the Families First Act, which is a somewhat different act than the CARES Act. It didn't get quite as much coverage as CARES, but it is also a federal assistance program that was passed by Congress. We received $107,000+ for senior programs, specifically for congregate and home delivered meals. There is no match for this, and it expires on 9/30 of 20. I'm sorry, I should have changed that. It needs to be 20, not 21. And then we received another allotment from the non-metro area agency on aging from the CARES Act funding for $133,000 for senior programs to include our respite care, nutrition services, and supportive services. Again, there is no match, and this one does have a 2-year period of expiring on 9/30/21. If you can move forward, Natalie. So what do we have out there pending still? Well, we have still the application that we submitted to FEMA for the Assistance to Firefighters grants. We requested $101,000+. That is for fire PPEs. That does include the PPEs that are going to various departments of the city. It covers COVID-19 response expenditures, equipment, and overtime. There is a 10% match required there. And then there is the FEMA disaster recovery funding. That is an ongoing application. We are anticipating a request of approximately $300,000 for the first year of the disaster. It does have a 25% match, and it is on a reimbursable basis. And this is specifically to prepare for, respond to, and recover from the COVID crisis. So many of the things that don't fit into the other categories, we are able to put into the FEMA disaster recovery and be reimbursed for. Unfortunately, loss of revenue and the leaves, the extraordinary leave and the quarantine leaves will not be covered under these this category. And then we have one to the IMLS, which is for our museums and libraries. We've requested $350,000 through an application. This is to provide digital programming at the museum and library. There is no requirement of match. And we are anticipating an announcement in August as to whether we've received that particular funding or not. Natalie, if you'll move forward. Here's some other recovery funding that we are looking at and keeping in mind. First of all, we received from Meals on Wheels America a $25,000 grant for senior programs, specifically for congregate and home delivered meals. There is no match, and we were awarded that. That is not through CARES funding, that is private funding. They then came back to us and said they have a second round available. So we've submitted an application for an additional $75,000 for the senior programs, congregate and home delivered meals. That is pending. We received notice this week that they are overwhelmed with applications, and it will take longer than they anticipated in providing us information on the awards. We're hoping to hear from that before the end of July. The CARES Act program also had an application process for EDA, economic development, and the grants office, as well as many community partners, have been working on trying to create a viable application that revolves around a project for the workforce development and somewhat of retooling our workforce towards specific industries that we feel might be providing high quality jobs in the future, after hopefully towards the end of our crisis, but for sure after our crisis. And then finally, we have from the New Mexico Department of Public Safety, for the Department of Justice Burn Justice Assistance Grant. There will be a second round of funding from that agency. And it will be, we anticipate the announcement for those applications to be submitted sometime in the fall. Natalie, if you'll move forward. So the big question everybody has on their minds is, what is the state doing with that $125 billion for municipalities with populations under 500,000? I want to remind all of you that the only municipality in the state of New Mexico to apply for and receive direct funding from the government was Albuquerque because of the size of their population. And during the special session in June, the state legislature considered multiple ways of distributing this funding. That was then vetoed by the governor because she felt that it was her prerogative to determine the distribution of that funding. And so now we are anticipating, in fact, today, we are anticipating DFA to send out what they call reimbursement forms and guidelines for getting direct COVID expenses reimbursed. We'll have a 2-week turnaround to do this, but they are anticipating that this may be a quarterly option for us. Again, one of the main things that has held back the state in really distributing this funding is that the federal government is not allowing revenue reimbursement with any of these funds. The hope is that with the CARES Act number 3, which is currently in discussion at the congressional level, will go back and allow for revenue reimbursement to occur with CARES Act funding. And that would allow the state to distribute the funding in the manners that we've talked about in the past, which may include the internet sales, tax calculations, population calculations. They had a variety of different options for calculating what they would send out. But until that happens, the state is somewhat tied in being able to just distribute out that money to communities. So they are starting at least to provide some reimbursement for direct COVID expenses, and the grants department with every other department in the city will be working on those things, on what those expenses would be. And I think if you'll move forward, Natalie, I think that was the end of my comments, but I'm happy to answer questions of any of the council.
Thank you, Amy. Did you mean, I thought I heard you say 125 billion. Did you mean 1.25 billion?
Mayor, it is 125 billion that we were awarded to the state. That the state.
That's an awful lot of money. I think it's 1.25 billion, but okay.
Yeah, Mr. Mayor, I can help explain that.
Okay.
I think it's 125 billion to all the states for those states that have municipal populations under 500,000. The state did get 1.25 billion.
Yes.
Yeah. Okay, so the 125 billion is for all the states, all the city. Okay. Yeah. Okay, that sounds right. I didn't think the state would get.
I apologize, Mayor, for misspeaking on that.
Oh no problem.
It's okay. It's okay. It's not easy.
Yeah, we're about all ready to jump in our car and go to Santa Fe right now.
Yes.
Yeah. Okay. So, did you have a question, Councilor Sorg? You had your hand up.
Oh, I'm sorry. I didn't put my hand down from before, I guess.
Okay.
There is one little thing I was going to mention. Sure. You know, as Natalie Green pointed out, all the things that the city is doing. And of course, we all agree that that is so necessary in this time of our crisis. It's so important. But I think we got to keep in mind that we need some long-term support for people that we're giving this money to now, so that they can sustain themselves and going way into the future, even when the COVID-19, hopefully, cross your fingers, is over with. But of course, we can do some things, but I think we really need help with the state and especially the federal government. So I'm hoping that in the not too distant future, we get some help from the federal government to do that. So I don't know what that's going to look like to get this long-term help, but it's needed, period. That's all, Mr. Mayor. Thank you.
Thank you. Councilor Bencomo, Mayor Pro Tem, and Councilor Beta-Stubbe.
Thank you, Mayor, and thank you, Natalie. Can you go back to the slide with the unemployment rates, please? Thank you. I mean, obviously, I'm glad to see them be this low, much lower than March and April, right? But I think they're still significantly higher than we usually see them. So I think it's important for us to, I mean, I think, Natalie, you mentioned it, right? But the agencies we worked with, like Community Action Agency, the Community Foundation of Southern New Mexico, Catholic Charities, they've all expended the funds that we had originally provided for them so that they could provide assistance to these 2,709 folks, perhaps. And so given though that there are still, there's still a higher level of unemployment claims that, you know, phase 2, or I don't even know what phase we're on anymore, continues to be pushed back fairly so, justifiably so. I want to make sure that these agencies continue to get support from us so that they can continue to support our communities who are currently struggling. Is there, Mr. Mayor, is there, I mean, I don't know what happens next, right? But I think we definitely need to look into another sort of local relief ordinance where we can start thinking about providing additional funds to these agencies.
Sure, absolutely. In fact, that's, I don't know if you recall, but last week when I brought that up to see if council wanted to do a second round, David, my assistant, mentioned this was going to be part of today's update. So absolutely. So let's, we'll get the rest of the comments from our colleagues, and then we'll determine if and what, at what amount, if council wants to move in that direction.
Great. And of course, I'll continue to push for assistance that gets, you know, more sort of direct cash in people's pockets so that they can spend it the way they need to, mortgage and rent.
Oh, you froze.
Am I gone?
We lost your response. I can hear you now.
Okay, I'm gonna turn my camera off. I was just saying that I definitely want to advocate for providing assistance to agencies that can get more direct relief to community members, to residents who are struggling, like cash assistance, mortgage and rent assistance, things like that. And then I did notice that perhaps, so given that the utilities department has its own emergency relief, and perhaps we need to extend that given how quickly they went through it this year. But I did notice that I think one of the agencies also was providing utility relief. So I want to make sure that we're not, that the assistance, that any funds we're providing to the community aren't doubling down so that they can get the maximum stretch to residents, right? So if we already have a utility assistance fund through the city, we shouldn't add another one through another agency. Does that make sense, Natalie?
Mr. Mayor, Councilor Bencomo, Natalie Green for the record. Yes, that would make sense. We do try, and many of the agencies are on the call today, and they work with each other to make sure we're not duplicating efforts. So that is a consideration that staff and the agencies are working on.
Great. Yeah, I think I had seen that Catholic Charities was doing some utilities assistance, and I wanted to just make sure that they know that there's already that, so that whatever funds they receive can go to people helping them pay mortgage and rent, you know, filling gaps that aren't currently being filled anywhere else. So thank you, Natalie. I appreciate this, and this workforce data. I know that at least I was one of the counselors that asked for it, so I really appreciate it, Dr. Payares. Thank you.
All right, thank you, Councilor. We have Mayor Pro Tem Gandara.
Thank you, Mayor, and Natalie, Dr. Payares, and Amy. You know, I wanted some more information about the current balance, the $901,000. Where is that at? Who has expended their funding? Kind of looking at, so I'm wanting a little more detail on that. Can you give me some more information on what that balance looks like and where it is for each of the agencies or the city stuff? Can you be more specific?
Sure. Mr. Mayor, members of council, Mayor Pro Tem, Councilor Gondeta, again, Natalie for the record. Is my spreadsheet up on the screen?
It's the workforce one, Natalie. The slide is on the screen now.
Okay, let me share the appropriate screen because I do have a spreadsheet that has a little bit more detail, and I apologize. It's my personal spreadsheet that I use for tracking, so it's not going to be the prettiest thing, but let's see. So, and again, a lot of this is subject to the fiscal year. The agencies may have spent the funding already, but because of the transition within fiscal years, not only did we have to amend some contracts, but we also have to renew and carry over that funding, and that happened Monday. So some agencies continue to spend, but we just have not reimbursed them. So this is actual expenditures out of our accounting system, so it may not be reflective of the individual agencies. But again, you should be able, the yellow column is what the current balance or our projected balance of those accounts are. But if you have
Natalie, are you saying that they're more specifically, these are agencies that we do business with and others, so this could be their contract, not specific to our COVID response?
This, Mr. Mayor, Mayor Pro Tem Gondeta, again, Natalie for the record, this is only COVID funding.
Okay.
And let me zoom out a little bit because some of the funding is in our other funds. Most of it sits within our healthcare fund. And then, of course, we had a few initiatives that were done outside of this fund, like the economic development and the Habitat for Humanity. So they are working on billing us, and much of that funding will be exhausted within the next few months.
Okay. Okay. So, Natalie, I appreciate seeing that. I think that's really important for us to see this. So there are just a couple or 3 agencies that have used their funding more specifically to COVID. I'm wanting to understand from each of them kind of what the gaps or barriers, what they were looking at. And before you answer that, I do want to remind us that although we have a utility fund that's specific to our water and gas, it could be electric, like people coming to ask for paying for electric and whatnot. And if you could be more specific when they bring up this is what we paid for, that it's electric bill, right? Or whatever else that might entail would be helpful. So I'm interested in understanding sort of gaps and barriers that this money couldn't pay for. I think we try to be as flexible as we could with the funding, or very specific things. And I'm kind of again, I'm going to keep talking about our senior services. I'm very concerned about these folks that are shut in. There's that organization that's working with Paul Ford's group that based on the limitations of our particular programs don't completely address. I want to make sure that we're addressing the needs accordingly. Can you talk to me, Natalie, about some of that trends? I'm looking for things of that nature.
Mr. Mayor, Mayor Pro Tem Gondeta, I'm going to defer to senior programs. I believe they're on the line, and also fire department. They have some information on some senior specific stuff.
Good afternoon, Mayor, Council. This is Sonia Saldaña with Senior Programs. Can you repeat that question, Councilor Gondeta?
Yeah, I'm not sure, Sonia. A couple of weeks ago, I received a letter forwarded on to Lynn Gallagher as it relates to some gaps of that our programs aren't meeting just because of the specific, the specifics on each of the programs. For instance, our Meals on Wheels are very specific to, I guess, a certain, I don't know all the guidelines, but I'm concerned about gaps that maybe our programs aren't addressing. I know that Paul Ford is so these are things like the shut-ins and not able to get Meals on Wheels, maybe because of their income. I don't know that, but still they're needing assistance. Is there any waiting list for any of the areas? I think those are all really important. I'm glad that we're using the money, but I really want to dig in a little deeper to have a better understanding of what you all are encountering out in the field, so that then we can propose something that addresses those needs, and that's not what I'm hearing here, and that's what I'm asking.
Okay, I can definitely answer that. We currently are feeding anybody that's coming to the program that is a senior that's requesting or exhibiting a need. We currently moved all the people that were coming to the centers, that were walking to the centers, because they wanted to walk to the centers. We moved them to our home delivered route just to minimize that exposure. So we moved those people to home delivered. We are receiving, our numbers have increased. We are receiving a lot of referrals. We are also providing weekend frozen meals to any of those that we have both on our congregate, which means those that come to the center and pick up lunch, and those that are shut-ins, that are homebound. So anyone that wants a weekend frozen meal, one for Saturday and one for Sunday, that's what they're getting. Our home delivered meal clients also receive a breakfast. So they receive both a breakfast and a lunch. So currently we are offering meals Monday through Sunday for all our homebound seniors, and including those that normally wouldn't qualify under our grant. We are providing those meals, and then also for the ones that are coming by to the grab and go sites. We have a lot of caregivers who are bringing their clients to our grab and go sites, and that just helps them minimize that exposure that they have out in the community, either by grocery shopping or by going to a restaurant. So we're trying to do the best that we can to minimize that and serve as many people, both disabled and elderly.
Okay. So with those disabled, I'm thinking about folks that might not have the ability to get up and unfreeze a meal, microwave it, those things. How are you addressing that? And with the funding, would you need additional funding to deal with just people's daily living, sort of assisting them in cleaning their home, that kind of thing?
So what we are currently doing, we are receiving referrals from the state. The referral services from the state, we get emails with information. A lot of people that we are being referred sometimes are under our age, they're under 50, but we are working with other agencies. So we work with Social Security, the case managers are really open to helping people apply for disability, are working with other agencies that might serve that population. So there's a constant dialogue with different people in the community. I know we worked a lot with Paul Ford and his team during the inception of COVID to be able to get those seniors that were high risk meals and food boxes and just check on them. Also, our drivers, when they go in, when they deliver the meals every day, those are our eyes and ears to see how the clients are doing. And of course, we also refer to Adult Protective Services. Our case managers are constantly referring people to Income Support Division, calling those caseworkers. So we're trying to do a lot with our, with the capacity that we have at the time. And anyone that we feel, based on our daily observations, our daily well-being calls, anyone that we feel that is in need, we have to make those referrals to Adult Protective Services, the police department, fire, any other agency, just to make those connections and make sure that those people are being taken care of.
Thank you, Sonia. So do you have any gaps, anybody on a waiting list that you can't quite manage given you don't not have the capacity for maybe the workload, that kind of thing?
You know what, I consider ourselves really blessed because we currently don't have anybody on a waiting list. The only people that may not be receiving services are the people that don't feel comfortable or don't want anybody in their home. In our respite care, we have been providing a lot of respite care for families just so that they can have a break. And even some of those sometimes will come back and say, this week I don't feel like I need anybody. But, we are consistently calling them, those that are on our caseloads, and just making sure that they're doing okay.
Okay. How are you working with Doña Ana Communities United? There's that time banking program that I think would be really essential for those folks, that not only, for folks that you're checking in, but not daily, but there's a connection there with someone, right? I'm also concerned with depression, anxiety, suicide ideations, those sorts of things. Do you have any connection with Doña Ana Community United? They are a funding, a group that we have funded, but I've always felt that time banking organization or program has been really helpful for folks.
Currently I couldn't give you any numbers of any referrals that we've made, but I can certainly check with staff, the case management staff. But like I had mentioned earlier, we reach out to different organizations based on the need and based on what's going on. So if it's somebody that is disabled that's being referred to us, we'll go ahead and reach out to those agencies that provide services for the disabled. And then we'll also try and figure out if there's anything else we can do. I know our case managers have been delivering food boxes. We have some churches that our drivers deliver food bags to on a monthly basis. So it's just trying to figure out where all those resources are. And even some of those resources, I know that some are limited, but we're just trying to do the best we can to connect those people to what's available. And of course, we always welcome any new agencies or services that want to partner with us to make sure that we are covering everybody out there that we possibly can.
Okay, all right. And so is Mr. Ford on the line to give us an update, Natalie, things that he's seen and concerns? I know that this particular group's made very specific, had very specific concerns about Paul no longer having funding, and the numbers are just going up, the kind of calls that he's getting as it relates to transportation, of picking up our elderly, right, getting them established back in their home, etc.
Mr. Mayor, Mayor Pro Tem Candida, I'm going to defer to Chief Enriquez. I believe he has his hand raised and he can answer for Paul. And then just as a side note, Lorenzo Alba is also on the call and he's been doing a lot of senior nutrition. So if you have any questions for him, he's also available to speak on that.
Sounds good. Thank you.
Chief Enriquez?
Yes, good afternoon, Mayor and Council. Mayor Pro Tem, yes, Paul Ford has been working throughout when the coronavirus pandemic first started, and there was no gathering, and we wanted to keep the distance and protect staff. One of the governor's orders was like for caseworkers and things of that nature. The individuals working at senior programs were not allowed to see the clients. We as a fire department and Paul Ford, especially with the MIH program, was then allowed, as the fire department is essential and can treat people. We took on the high-risk clients. They turned out to be about 45 seniors that were high risk that needed assistance, and he'd follow up and check on them. At that time, we had the funding and staffing available to assist Paul with that. So during those times, it was working good. I think there was a timing issue when the end of the year budget came up, And we had the reopening as well by the governor opening up certain things that case managers were able to go. We turned over those high risk back over to senior programs. And so that's where I think the resources and the other agencies that Paul was working with, especially faith-based churches, faith-based organizations, were working all together to assist this vulnerable group. Now I can tell you we're back on track. Senior program is doing theirs. Paul has about a handful of those high risk that he still delivers food boxes through Casa Peregrinos and other faith-based organizations that provide food. Paul is also working with the other agencies to align those resources as needs from mental depression, other things, prescriptions with pharmacists and just other agencies to help those in need. And as we get those referrals, we start to do that. I think when you received your email, as I was saying, I think there was a gap in the reopening and shifting of clients from back to the senior programs away, and maybe some funding issues with the budget. But we have a grant now that even the state put on hold, where we will have a case manager, but we're allowed to put another staff member, an EMT, in the MIH program to assist Paul and to help us with that through some grant funding. So I believe we're back on track. There will be some gaps, of course, but I think we're back on track with the email that you had sent in reference to some of the issues. I think the biggest one is the transportation for some of the senior staff that needed to seek medical attention in El Paso, and that was something that we couldn't deliver, but I know a lot of the faith-based organizations were taking care of that and helping with that.
I thank you, Chief. I appreciate that. And I do know, because I had made reference to the fiscal year ending and one will begin, there should be some different, some new, not new funding, but a replenishing of the funding and such. She did mention the woman that I was communicating with, it did mention the transportation. I think the problem is that that group is getting ready to transition out for the fall, and there's a huge gap. And so so they're no longer going to be able to provide. Yes, they were providing that transportation, and it was getting increasingly more difficult for them to do that. That's a huge volunteer organization that basically, is being called out from the hospitals upon the patient's discharge. And so I'm hoping that it sounded like there had been some convening of groups coming together, but there hadn't been a solution or a strategy developed to be able to help this, because it was happening more often. And so that's challenging. And so I guess I'm just saying, like to know what the gaps are. If we need to provide a certain funding mechanism or an additional program that goes out to pick up our constituents, right, our citizenry from El Paso to bring them home, then I'd like to hear about that so we can make the necessary adjustments. So thank you, Chief Enriquez. Is the transportation the still free through the Roadrunner during COVID?
I believe so. See if David's on David, or I don't think my mic is. David Dollahan or David Maestas, can you guys respond?
Letter is on the line too, Mayor.
Mr. Mayor, David Dollahan for the record. Roadrunner is still free. We are working on expanded return to work plans for sometime in August to go back to more normal services related to hours. That we just started that discussion this week. We're hoping for August 17th to go back to expanded evening and Saturday hours.
Okay.
But one of my discussions with staff, specifically to yesterday, was that we want to maintain the free status. One, because of the need in the community, and limited transportation opportunities. But the other thing is it also makes our workers safer by not having to handle cash. So that's one of our motivating reasons. And under the CARES Act, we're not that we got for transit, we're not required to collect fares. That's been an opportunity to suspend that. So our plan is not to charge fares, and we're not currently.
Okay, thanks, Dave.
Thanks. Thank you. I think that's it for now, Mayor. I am in agreement for a second phase of funding if we can. I just want to, again, continue to hear the gaps and barriers, what COVID has created. I continue to be very concerned with our immigrant population. When Councilor Bencomo asked to go back to that slide, I think it was slide 10 with the unemployment compensation, those things. I wondered, is our immigrant workers or families being able to utilize that? I don't think so. I would be challenged. I think so. How do we help? It just feels like when we know more specifically that in our service industry that a lot of our immigrant our workers are immigrant or mixed status, that slide to me is somewhat inaccurate, right? And so how do we know what those numbers are, and how do we continue to help our workforce, especially as we move forward and know, and I continue to hear workers being deathly afraid to go to work, and yet we have the Restaurant Association really pushing us to open up our restaurants and whatnot. And thankfully, I hope that people have been encouraged with getting, being able to do outside dining and such. But when you hear things like 18% is sort of where people are contracting COVID through restaurants, that's a lot. That's a lot. And so we really need to reconsider what we're asking, not only our restaurants, but our workers. It's a very, very scary time. So I continue to feel like we should, I don't know where we could get that information. Oh, Johanna, you sent me I don't know who sent me, I don't remember, maybe it was somebody else who sent me an article with the sheer numbers of what we know in New Mexico, but more specifically, I wonder if somewhere we can get those numbers specific to Las Cruces around our immigrant population, because they're afraid to get tested. They're afraid to go and seek medical attention. They don't apply or can't qualify for all these the services that the feds are putting out and state is putting out as it relates to getting unemployment. So continue to be really worried about that, especially as the kids are moving into virtual learning. I noticed that, Mayor, the money that we gave the schools hasn't been utilized, and I think they were looking at this next school year, and so I just want us to keep an eye on that and making sure we are effectively helping where there's the most need. So I think.
Sure. Well, let me just thank you for your comments on that. Let me just share with you what every week or every other week, the various mayors around the state have calls. And so I'm just going to share with you what I'm going to suggest to them regarding the restaurants real quick. Basically, I know still no indoor dining, I understand that, but I wonder if they would allow food buffet. So the food's prepared. People can go in, they have to wear a mask. They just get the food, get it ready to go, and then they're out the door. So they're not sitting in there. They're just running through, they can still sell their food, but they don't sit inside. They just, just dash and go, grab and go, and, pay for it, and out the door they go. So it'll still allow them to have the cooks to people employment, but you're not sitting there, you have your mask on, and so on and so forth. So we'll see what the rest of the mayors say on that. And then what I was thinking, and I'll let first Councilor Flores, and then I'll let Councilor Bencomo jump in. But basically what I was going to suggest was to let Natalie and staff kind of go back and see who may need some additional funding, and then bring that forward to us, and then we might approve that for the second round. So, Councilor Flores, question?
Yes, thank you. Thank you, Mr. Mayor. Francisco Payares, are you still available? I have a question about.
Yes, Councilor Flores.
Oh, wonderful. Thank you. So if you could go back to slide 10, the one that shows the unemployment levels. Well, oh, there it is. Okay, thank you. Dr. Payares, how are the unemployment claims being filed? Because I know that some of the rules have changed. I know that we as employees pay into that unemployment fund. And when we're unemployed, we apply, and then there's a time when the funds run out, or there's a time limit. So to what are the the downturns attributed? Do you know what factors?
Thank you very much, Councilor Flores, Mr. Mayor. This is Francisco Payares for the record. The specific process, the administrative process for which this gets filed, I do not know it exactly, Councilor Flores. This is more of a question related to workforce connections and exactly how their administrative process goes to filing the claims. I know that there were some changes with regards to some of the legislation, and this may be tied to where they get some of their money from. They may be getting some of their money from the federal government or either the state government, and depending on how they get it, they might change the eligibility of how they can access some of the claims. I do remember that furloughed employees could access it. I do know that employees that were laid off because of the pandemic can access it. But there was also some changes with regards to self-employed individuals that were able to access it. But those rules have been changing, and I know they've been changing even faster with the pandemic. That is a question that exceeds my administrative abilities. I think that would be, but I can definitely look for it and request some information as to what qualifies someone to be unemployed with New Mexico workforce connections. That's a follow-up question I can pursue. As to with your second question, what accounts for some of that downturn that you have seen right there? Some of the information that we've been able to see, at least from commentaries and from discussions, is that the PPP loan, as well as the EIDL loan that came from the government, from the federal government, did require some businesses to rehire back the employees in order to access them. So that this could be a portion of what we are observing here, that by rehiring back some of the employees in order to access some of these loans, they're forced to, the claims usually come down. Another portion of that might be the stages of the reopening of the economy. So as it has progressively been increasing, we're not as restrictive as we were in the middle of, the latter portion of March, early portion of April, have also allowed to some of the operations to follow through. So as more health data has become available and some of the recommendations have become available and more information from the health perspective has become available, we have now seen more businesses that have adapted to. So that could be another portion to that. So that's the response that I can give to both of your questions. I'm not sure whether they're full responses to your answer, but they are at least a portion of that.
Yes, I appreciate your answers very much, Dr. Payares. And if there's any way of breaking it down to find out exactly what those contributing factors are, or what the factors are, it'd be good to know exactly what our workforce looks like. It just seems incredible, not incredible, but I just want to understand how we could go from having almost 3,000 unemployed to, about 500 unemployment at this point. Because there must have been wonderful things that happened with Workforce Solutions, our department there, or the federal government subsidizing employers. I would love to, think that that's what it was. So anyway, thank you very much, Dr. Payares. I appreciate it. I look forward to a follow-up. Thank you. Thank you, Mr. Mayor.
Okay, thank you, Councilor. So again, thank you very much for this information. And David, yes. So David, you think that, well, let me just make sure, Councilor Bencomo. So Councilor Bencomo, we're good with just letting staff kind of go through, clarify some of the numbers, maybe reach out to those nonprofits that we helped on the first round, see if what amount of funding they may need for round 2, and then bring it back to us?
Yes, Mr. Mayor, I think that's fine.
Okay. Good. Okay, David, that's Maestas, we're good?
Yes, Mr. Mayor, thank you. That's exactly what I was looking for. The discussion we had here today was very good. We did have members from the community as well available, but it does sound like we have a clear direction on how we want to move forward, and then we can put together, based on the input now today and follow up with our community, some recommendations to council for the next round of funding.
Very good. Okay, well, if there's nothing further, entertain a motion to adjourn.
So moved.
Second, Bencomo.
Motion made by Councilor Flores, seconded by Councilor Bencomo. All those in favor signify by saying aye that we adjourn.
Aye.
Aye. Those opposed? Okay, we're going to adjourn at 12:36 p.m. Thank you. You all have a safe and happy
Weekend.
Thank you, Mr. Mayor. You too.
Bye-bye.
Bye.
Thank you, everyone.
Thank you, David.